Good morning, everybody. Welcome to the People and Health Scrutiny Committee, where the main item on the agenda will be the budget for 24-25. Welcome all members, officers. Thank you very much for attending today, and thank you very much for all those who are attending online. If any of those online would like to ask questions, please can you just do the raise hand as usual. I think we can go straight into the meeting. Just for clarification, I've asked Councillor Ireland to sit with me as Vice Chair. There is apparently no need to nominate and approve a Vice Chair. It's only a requirement for if the Chair is absent. So I've asked Nick if he'll sit next to me and help me Vice Chair. It's particularly important when we've got people online because it's hard enough controlling everybody in the chamber, let alone trying to see who wants to speak online. I'm intending to run this meeting in a fairly relaxed manner, so please feel free, councillors, to interject and ask questions. It will, of course, end up with the committee members asking questions as of right. But I want to make this meeting as open and inclusive as we can. And that also goes for any councillors who are online this morning. Can I just ask you, when you do speak, if you can introduce yourself for the benefit of the cameras? And I do apologise because I didn't introduce myself. I'm Jill Taylor. I'm Councillor for Weston West and I'm the Chair of this committee. So if we can go into the committee, could I have apologies, please? George?
Good morning. We have apologies from Councillors Paul Kimber, Belinda Rideout, Bill Pipe and Molly Rennie, who may be joining the meeting online.
Thank you very much. Could I have any declarations of interest, please, from any members of the committee?
Yeah, Councillor Nick Ireland. My usual declaration, I'm a Governor of Dorset Healthcare appointed by this council. Thank you.
If anybody else has any declarations during the meeting, can you put your hand up and let it be known and we'll record them? If I can go on to the minutes of the last meeting, which was the 11th of December, are there any comments on that? These are just for approval. Okay, can I have a proposer, please? If I propose and Councillor Ireland has seconded, if we just vote on that. Committee members, thank you very much. That's unanimous. Public participation. Have we been notified of any questions, George? No, we have no questions. And we have no questions from members at the moment, but as I've said, please feel free to ask your questions during the meeting. Urgent items, we have no urgent items. Oh dear, do excuse me. And we're now on to the committee and cabinet forward plans. So if we can just have a quick look at those. I've got no announcements with those apart from what's in the papers before us. So if anybody's got any comments they'd like to make on the forward plan, please let me know now. Otherwise, we'll skip over those. We have our own agendas there. We've got the Cabinet Forward Plan. And we've got, gosh, what's the next one? Let me just check, get the naming right. We've got the Shareholder Committee for Care Dorset. And we've probably got the Centre of Excellence forward plan as well. So with that, with no comments on that, can I please move on to the budget, please, which we're on to page 37. So, if I can hand over to Aidan to introduce it, that would be really good. So thank you very much, Aidan. If you can just do an overview for us, that would be fine. Thank you.
Thank you, and good morning, everybody. I'm Aidan Dunn, Executive Director for Corporate Development for Dorset Council and Chief Finance Officer. So if I could set the scene for the budget that you have in front of you. First of all, if I could set the scene nationally and regionally. These are really demanding times in local government finance, and you'll have seen in newspaper headlines over the recent months and years about the real pressure that local government is under. And just recently, in the last week or so, you'll have seen that Somerset Council is grappling with a £100 million budget gap. Hampshire Council has started a consultation on £130 million worth of budget savings. So this is really, really difficult times for local government. Nevertheless, what we have in front of us today is a balanced budget proposal which seeks to manage the rising demand and cost of services whilst protecting those frontline services for our residents as well. So the key features of the budget and the papers that you have in front of you outline that there's overall an 8% increase in funding in terms of the proposed increase. There's £18 million of service efficiencies through transformation and general efficiencies. We're aware, and we've discussed through Cabinet, and members will be aware of the pressures that the budget is under this current financial year. So the budget proposals for next year address those underlying pressures that we're experiencing this year as well. But in addition to that £18 million of service efficiencies, we're also looking forward in a transformational approach with a budget savings target of £12 million from the Our Future Council programme, which was launched by Cabinet in November. Now, the Our Future Council programme, as I say, is a long-term 7-year programme to reimagine and redesign the council. As part of that, there is, for next year, a 12 million savings attached to the programme. But recognising that there is a degree of risk to that, we are underwriting, or prepared to underwrite. We've set aside reserves in these budget programmes to underwrite that £12 million worth of risk. From a resident's perspective, the budget proposals you have in front of you will be recommending a council tax increase of just under 3% and an adult social care precept increase of just under 2%. So combined, residents would be experiencing just under 5% overall increase in their council tax. The budget proposals will also impact on residents through a range of increasing of charges, but fundamentally, this is a budget about service efficiencies and not service cuts. So if I can set that in the context for you to explore as a committee today, this budget, as I said at the beginning, it's a very challenging time for local government, and I'd consider an extensive degree of member involvement in preparation of these proposals today that are now being publicly scrutinised. So the budget proposal, or from a member perspective, the process began in September with a training session for all members, should they choose to take it, on budget scrutiny, given the degree of risk around the budget. We've had 3 budget cafes, which have combined with about 10 hours or so of member briefings, and in addition there have been 4 task and finish groups. But now these budget proposals that have been worked on behind the scenes are in front of you for public scrutiny. So within the papers, we have a 64-page budget report that covers all aspects of the council's finances. And the way we've structured it is actually the budget proposal that is going to Cabinet, subject to the recommendation of both today's committee, which is looking at adults, housing, children's and public health services. And then next Wednesday's committee, the Place and Resources Committee, will be looking at corporate place budgets and any other resource-related assumptions. So if I could use that to set the context of the highlight of the budget proposals. And we have in the room here colleagues from adults, housing and children's services who I hope you'll be able to explore with the context of what the budget proposals will mean for local residents and their service users, and a real opportunity for you to explore that. From a finance perspective, there's one real point I really want to underline. I started by describing the challenges that other local authorities are experiencing, and whilst we are facing similar challenges, one of the things that makes Dorset stand out is the high quality of both children's services and adults and housing services that we have at the moment, and it is due to, I believe, their skill and forward thinking that means that they are in a much more financially controlled and planned space than many other local authorities around the country. And I know personally that colleagues across the country are in admiration of what the services our adults and children's and housing are able to provide within the financial envelope they have. And that may be an area you wish to explore today. So on that basis, Chair, set the scene. I'll hand back to you to explore those areas. Thank you.
Thank you, Aidan. That was really helpful. Just for clarification, what I'm going to do today and what I want to end up today is with a paper that we hand forward to Cabinet. So we're here to scrutinise the budget. So we're here to look at the robustness of the proposals within it and to challenge the robustness of them. And what I want to end up with is a document with questions that we have asked and the answers that the officers have given, so that they know that we have challenged this budget and basically put forward not our proposals, but where our concerns are. I've put a number of areas that I thought we might like to explore, and I think I'm just looking at Teresa Levy, who's the head of Children's Services. I know she wants to go fairly early in the proceedings. I haven't got a specific one for children's, but I think children's will come right the way across. I've sort of gone on topics this year rather than going on individual budgets. So I'm just going to invite Teresa to just do your presentation now, which is a very, very short one, and we can ask questions on that. And then I'm going to go back and examine more on the fees and charges transformation, what I put down on the list that I sent you the other day. So if I can hand over to Teresa, that would be brilliant. Thank you.
Thank you, Chair. Good morning, colleagues. And thank you for the opportunity just to respond to what I'm aware of some of the kind of headlines you were looking to explore around children's services budgets. So, George, I don't know if you can share the presentation on my behalf. That would be great. You are. Thank you. I think, as you've already heard this morning, one of the opportunities we have in children's services, and therefore a resultant opportunity equally for the Council, is that we are now well into our 5-year plan of transformation. In fact, this will become our 4th year. And that transformation has been absolutely rooted in those principles that we've established and discussed here for now many years, which is about getting families help sooner in order to de-escalate need and risk and therefore limit cost and overhead. And that's been well evidenced both locally and sadly not so well evidenced nationally, where we're seeing huge pressures in children's services budgets across the country. So where we've been able to both make the best use of that funding, and you can see there on the right-hand side the investment funding that we've received through that period of about 4 million, turning in a return on investment of about 19 million. I think across the years of COVID and the real challenges in the children's services market is quite exceptional and extraordinary, and absolutely down to the incredible communities that we serve and the work of our staff. We know that over those years, people have been working assiduously to ensure that only the right children come into our care at the right time, and where they do come into our care increasingly, that these can be children that are cared for by foster families and cared for more locally. That remains a big part of our agenda, and it remains a big part of the challenge. We know that the care market, again, nationally has been discussed extensively around both the increased profits in that market and the challenge in terms of the low level of provision that's available nationally and locally. And so the kind of metrics of that are obvious. But our commissioning teams and our care teams work incredibly hard to make sure that the children get into the right placements at the right time. And that steadiness is what's really supported us in our budget management over the last few years. We'll continue with that and using the opportunities of the projects that we've again discussed at length here previously. If I could have the next slide, please, George. Thank you. So all of those areas that we've previously been working on, making sure that we have the right practitioners supporting the right families, increasing that ability through our Pathfinder work. So as Dorset is a Pathfinder for Families First for Children, that whole new policy change is very in line with our own Safeguarding Families Together programme, which is already showing big impact, where we're working incredibly closely with those adult practitioners in order to make sure families can have their needs met in one place and earlier. Our digital family offer is very much a kind of in line with the future council intentions and the plans. We've already been working in that very much that family hubs place, locality working. And so we absolutely will be looking forward to joining other members of the council into that sort of future council approach that we've been delivering for many years now. And again, really close work with our adult services colleagues in that birth to settled adulthood approach, making sure that those young people don't meet a cliff edge at 18, wanting to make sure that young people, I think we all know young people of 18, 19 need ongoing support, and looking forward to delivering that as we've been working very intensively with adult services colleagues on that for some time. That in itself clearly creates better outcomes for our young people, and in doing so will produce some savings. Thank you, George. Children's services can't particularly bring in significant income. That's not a world that we occupy. There are some areas where we can make charges, but they're very minor. However, what we look to do is to bring in additional funding from across a range of bids and opportunities. And again, we've been very successful in the most recent years around the level of funding that we have been able to bring in to support the council and to support the delivery of children's services. And they're just sort of laid out there in terms of the various schemes, the various opportunities. We don't bid for everything. We only make sure that we bid for things that are absolutely in line with our strategy and our policies. But we've been very successful, and I think the reputation of Dorset nationally is very positive and has been very helpful to us in being a trailblazer, pathfinder, whatever the language of the day is. But we've certainly been in a position where we've been able to be at the forefront and the vanguard of a number of new policy initiatives and brought that money in alongside that. I think the final area that you had raised previously around kind of wanting to understand was around SEND, and particularly the association with the budget that's held within the Place Directorate around travel. And so just a very few headlines in our final slide around what we're doing in children's services to really think about having an impact upon those children with special educational needs and therefore an associated impact on the overheads of travel. Can I have the final slide, please, George, and that will be my presentation. So we have a very clear, very extensive SEND strategy. It's been running now for some time, responding to the increased level of need in our children in our communities. Again, it's well evidenced nationally and locally that both school attendance and our young people's well-being has been significantly impacted through the COVID years. And we've been working heavily to get more and sooner help for children in order to keep them within mainstream provision and to return our children to school in a range of activities around attendance. That will continue. And again, the campaign for 2024 is attendance is everybody's business, and we'll be delivering that through. We know if our children are in school, they're more likely to stay in their mainstream provision. But we're also working heavily with the previous allocation of SEND capital support that was placed by the council as part of the SEND capital programme to make sure that there is more provision locally and closer to existing school bases which keep children in their community. And then finally, increasing our availability via Coombe House of our local independent specialist provision means that we can also keep the cost down in terms of independent specialist provision and therefore be able to make sure that those young people who do require a specialist school can do so in a more local way via Coombe House. Thank you, Chair.
Thank you. That was a really useful presentation and beautifully short, so I do compliment you very much and very much to the point of what we need to talk about. Have I got questions on that? I've got a few myself, so I'm going to dive in at the moment. This year, you're looking at 4.25 million savings. I'm just wondering, how have the savings gone over the previous years and how realistic is the 4.225 million for this year? And yeah, so if you could just answer that question first, please.
Thank you. So those savings have all been through our transformation programme. So in the way that I was just showing in that previous slide, we have confidence now in year 4 that we know that the impact of the various programmes of work that we're delivering, so that earlier support, we've been not only able to make those savings, but actually we have increased the level of frontline practitioners and the level of families that are receiving early help in the county. So we know that in addition to the 1,100 children who receive a child in need service, we have approximately the same number of children who are receiving a family help service. And it's really clear to us from our family feedback and from the Oxford Brookes review that's been undertaken, which will come to Council soon, that actually that impact is really evident. Our families are showing us, telling us, and they're telling certainly our university colleagues, that they have really experienced the support earlier and that therefore their families' needs haven't escalated. That doesn't mean that we're not pushing against a tide of escalating family need generally. Absolutely, our families are living in very difficult circumstances and the cost of living crisis nationally is impacting just as hard locally as anywhere else. And we know that over years, families' resources get depleted, both financial ones and psychological and emotional ones. But what we can see is that the way in which the council have been able to continue to support more families means that we're not seeing the kind of levels of increase in children coming into care that other counties and other unitaries and other authorities across the country are experiencing. So our sense is that steady as we go. We are beginning to see an increase in the number of fostering households that we can assess. We know that's been a really difficult tanker to turn, but the Mockingbird approach is certainly working there, both in terms of encouraging people to come forward to foster, but also in maintaining stability in our existing fostering placements. And we're also exceptionally pleased to see an increase in our kinship care placements. So what we really understand by the new policy, but we're already seeing on the ground here in Dorset, is that more and more families supported to care for their extended families. And we can see that in our data at the present time. All of that has been alongside an increase in our unaccompanied asylum-seeking children population, which for sure has an additional cost pressure, which we have taken into the base budget and formalised this year through the increase and development, really, of a dedicated service. Whilst we recoup full cost for the accommodation for those people, and for those young people in particular, for those under 18, we can recoup that cost. We can't presently recoup cost for their social worker, their reviewing officer, any interpretation. And we have been able to baseline that within this existing budget. And still we believe that we'll be able to make those savings. It will be challenging, it will be tough, but as you know, Children's Services put their shoulder to the wheel, and we're confident we will make those savings.
Okay, thank you very much. Have you, just come back to the original question, have you achieved the savings over the previous years?
Between 85 and 90%, and where we haven't achieved them, it's because we've made a decision not to achieve them in that year, but we've been able to balance pretty much the budgets. And we're confident, even though in Q3 we're continuing to see some pressures at the present time, we continue to look very flexibly across our budgets. If we think, at the beginning of the year, sometimes you set a saving, and then as the year goes by, you think, okay, I need to adjust. I would be worried if we weren't adjusting in year. I'd think that would be a bad sign. But so we'll adjust to that and achieve them elsewhere if we need to.
Okay, that's brilliant. So are you looking at, just looking where the savings actually are we looking at any staffing cuts? Because I would be quite concerned if we're looking at staffing cuts, but if it's not there, then where else are we looking for savings?
So the Pathfinder programme is an increase in staffing across the next year, and we welcome that. What we want to be able to do through the Pathfinder and the investment that we've achieved there of over £4 million is to see an increase in that targeted youth work, which again we've seen the evidence and the impact of, an increase in those staff who are going to be focusing on attendance in schools. We've also invested heavily in social work oversight within family help as required by the policy. At the present time, we would always be looking to rethink any vacancies that occurred, and we do that on a regular fortnightly basis with all vacancies to be recruited to. Is this the right post? Do we redesign? Do we re-engineer? Is there a subtlety we need to make? But at the present time, none of our savings proposals includes cuts to people.
That's really good to hear. And could I just have some assurances that you're not looking on a block on recruitment or anything like that to save money?
Me and my senior leadership team review every vacancy every fortnight. We always have done. We review that to make sure that they're the right role in the right place at the right time. We absolutely do ask ourselves in a time of tight constraints, do we need to recruit to this right now? Do we hold off for 3 months? Do we change the role? I think that's appropriate leadership activity. My teams understand that. They accept it. They're very good at campaigning for why that post has to be filled, but we'll continue to give that kind of assiduous attention to making sure that we recruit where it's needed for our services to continue to deliver. But there are, from time to time, a need for us to delay in order to make sure that that's the right post.
Thank you. Councillor Azard, who's on the list? Yeah, sorry, Councillor Azard next.
Thank you, Chairman. Yeah, I'd like to ask, I'm looking at the budget actually on here, and it says savings. I know you're just setting up the family hubs and they're not all in place. How come you can put down that you're going to make a savings on that? Because I thought that was part of that 4 million from the Pathfinder scheme from government. Thank you.
Thank you. Thank you for your question. Really helpful. And sometimes it can feel very, very complex, can't it? The reality is we are already running some family hubs. We will continue to roll that out this year. The family hub delivery should see more and more families getting help earlier. So as we've said previously, we know that 98% of our families simply want the best for their children, and we simply need to make sure that we wrap around support as soon as possible in order for that to happen. As we do that, we will have less high-level need, and that's where the savings comes through. So it's not that we're making savings out of the family hubs, we're making savings out of outcomes for families by having less high-level need. So although it can seem like a strange thing to say these savings are from the family hubs, well, they're from the intervention and the impact of the family hubs rather than from the family hubs themselves.
Thank you. So really, you're hoping that's going to happen. You don't really know that it would happen, but so you're quite convinced that that this will be a saving with the way that you're working with your families. You know, when you say savings, are these supposed to be guesses or are they actuals? I mean, obviously, for the next year, it's difficult to say.
40 years tells me that they're more than guesses, and 4 years of the 5-year plan tells me they're more than guesses. So what we can be confident about is that actually the approaches that we're able to take with the Dorset communities, that if we can get help to families sooner, they can manage their needs more effectively, and therefore they don't need to come into our care or into a very intensive level of intervention. So it's more than guess. It's definitely rooted in expertise and experience and the evidence base that we are blessed with in children's services now about what works. Clearly, we've had to respond to really unknown matters in the last few years around COVID and other things, and we respond to those as we go. We track ourselves against other good and outstanding authorities. We spend every month, we look in our performance board around how are others doing, where's the best practice, and again, on a very live, reflexive basis, we respond to those things. So more than a guess, But I would love to have that crystal ball, which I don't. But the reality is it's fairly well rooted in an evidence base. Thank you, Councillor Azad.
Okay, has anyone got any more questions? I've got another number of questions here. Did you want to come in, Councillor Ireland, on your questions, or?
Yeah, sorry, I have two areas I want to investigate. Sorry, we were going to go through themes. The first one is related to the first theme, so just in case you need to leave, and the other one isn't really related to any of them. So I guess the first one I'll ask, there's a table on page 62/63, which is described as basically budget increases in 9 areas. So the first theme is fees and charges, and I think we probably all agree, certainly as members, that we, as a council, we should be trying to generate more income through whatever means we can. But there's an entry there about traded services income removal, which basically says you won't be generating any money from this anymore, which is going to cost £0.6 million. So I guess 2 questions. Why is this? And are there any other areas in the Children's Directorate that does generate income? If so, what are they?
Thank you, Councillor Ireland. We attempted to look at a possibility of having a trading model for education support services within our education framework. We looked at this as a possibility and invested in some capacity to see if that would work across our system. We have a largely academised system now in Dorset, but not completely. And so the opportunity for us to really test that system last year around, is this a system which wants to buy from the council around these education support services, or do they want to buy elsewhere? And most importantly, is it worth it for us in terms of the income? We looked heavily at that and thought whilst we were being able to trade in some parts, it wasn't, in our opinion, the appropriate thing for us to be doing in terms of the level of benefit, profit, if you like, that was going to bring into the council. We have to make a judgment at all times around, for example, things like the scarcity of educational psychology resource across the county and across the country. Do we make sure that we can respond really quickly and effectively to our own children with SEND needs, for example, for an educational psychology assessment, and therefore be able to do things more rapidly there and have a positive impact upon the high needs block issue? Or do we have a capacity of educational psychologists who we trade and therefore make some income? And we've had to make those sorts of judgments all year. And on balance, we determined that it was better that we focused all of those resources that we can have and can have good cover for into actually delivering what we have to deliver to our children ourselves. So we have stepped away from that trading model. Most local authorities have. There is quite a good private sector for such matters, as you can imagine, that schools can buy into. And our academies often support each other in that as they go forward. So it's more about us, we tested it, we tested the kind of potential for that and felt that actually on balance it was a risk for us that we didn't want to see happening. In terms of other areas where we may trade and where we kind of see the opportunity for those things, I kind of guess a key one for us is in the outdoor education service that has come over from place into children's services. That has had some real success in some areas in terms of their trading. But again, as you'd appreciate, school budgets are under pressure, and it's an area where we're keeping a very conspicuous eye too, in terms of making sure that those services can certainly wash their own face, if not bring in some income. We are keen to see those services continue to deliver to the most vulnerable in our community, as well as more generally to schools. So we're looking at, as we go forward into this year, making sure that we direct that resource into the right place of those most vulnerable, as part of the bigger policy of making sure that we understand if those most vulnerable are getting their needs met, that whole budget will be effective. There are very few other places that children's services can trade. We do have leadership of the Pan Dorset Safeguarding Children's Partnership, and in there we sell some training to other partners. But as you'll appreciate, we want to make sure that some of the more, or certainly some of the smaller providers who are in our framework sometimes receive free training from us. We think that's the right thing to do. So if we're looking at small early years providers, for example, we may well look to make sure that we provide training for them in certain areas, particularly where they're emergent areas. So if we look at the theme of something like contextual safeguarding, we will sometimes put on training for the multi-agency provision, and we won't charge for it because we think it's most important that people attend. Where we think people can pay for it, we charge. but it's a delicate balance across the whole piece. And of course, for most children's services, they're not chargeable, unlike adult services. These are services that people often only want after they've had them.
Yeah, thank you for that. I have no comeback on that. I do have another question whilst you're here. Actually, the same table has an entry. So I guess the background to this is that Dorset Council, and I guess other councils, as a Dorset councillor, it's in our purview. We get criticised in the press quite often for, let's say, top-heavy management, lots of people on six-figure salaries, and the same table has an entry which is birth to settled adulthood head of service, which apparently is going to have a salary of £110,000. Can you explain what this post is and maybe quantify the benefit to the council of employing such a person? Thank you.
Thank you. Our families have been telling us for many years that they want children's, adults and health services where their children have disabilities or special educational needs to work together in a much more intensive and integrated way. So the Birth to Settled Adulthood programme has all been about children's and adult services, along with our health colleagues, thinking about how we come together to make sure that families don't have to continue to navigate different pathways and different services. It's a really very complex world, as I know you will all appreciate, around those really children with really complex needs. As they go into adulthood in particular, we're really clear that we want to continue to offer more intensive services up to 25. And those more intensive services being much more planned. And so if we think about an example, we know for some of our 11, 12, 13, 14-year-olds, we know they're going to continue to need ongoing 24/7 care well into adulthood. We can continue now to plan for that within one service area rather than see a transition at 18. And I'm incredibly pleased to be able to say that the work within adults and children has progressed rapidly with that. And we're looking forward to health integrating further in the second phase. That level of oversight, that level of complexity of young people with learning disability, physical disability, mental health challenges requires a very particular significant leadership. I think that role will be very demanding. We've actually had conversations about, how much strength and breadth that individual will need to have. We will be recruiting to that very soon. I think it's a complex role, which in its effect and in its leadership, and I think therefore in its delivery, will see real benefit to the council. The value that you quote is with on costs and isn't the actual received salary by the individual. It is markedly judged in terms of equal cost with other posts like it around the area.
Thank you. I just wanted to ask a couple of questions around going forward into the future, because I think there's so much volatility within the budgets and so much uncertainty at the moment. If I can just turn to 1922 on here. This is talking about children's services nationally are experiencing significant service pressures and will be subject to major policy change within the next 1 to 2 years. Policy changes always have financial implications, and I just wondered how well prepared, what our thoughts are on that, where we're going with this, because it's going to be a different world for children by the look of it within 1 to 2 years.
Thank you, Chair. And I think it's we received 8 new policy documents from the Department of Education on the last day of the Christmas break. So we're still ploughing through those to make sure that we understand all of the implications of that. However, where we're very blessed is by being a pathfinder. We are ahead of that in terms of what others will need to do. So just for complete clarification, whilst we will change our service design very much in line with where we were already going throughout this year and into next year, other colleagues are only just coming on board across the country. So Dorset was one of the first 3 pathfinders. The next 6 have now been identified, and we're busy supporting them in thinking about getting to their first stage of delivery of this policy, and the rest of the country will follow. That does give us an opportunity, clearly, to go first. There are some challenges with that. We are doing some test and learn, for sure, and I made no secret of the fact that I didn't think that the funding was quite enough at the first stage, and we went back to the Department of Education with a bid for further funding and received a further 440,000 as a result of those conversations. So I'm confident that that element of family help and child protection, we have really got a very good start on in terms of the policies that will be coming down the road for others. There are further policy changes, absolutely, in terms of attendance, in terms of working together and the role of education. And we, again, are very heavily involved with national government in the design of many of those things. So where I feel that we've got a kind of, a run on the market really is that we are very heavily involved with central government in terms of how those things are designed. Doesn't mean that we are not in a kind of critical friend place at times with central government around that. We absolutely are. We think it's really important by being a pathfinder that we put good support and challenge into that, but it is an equal balance of support and challenge.
Okay, thank you for that assurance. It's going to be an interesting time over the next few years as to where children's services are going to go and our contribution nationally, to be quite honest. I've got a question from David Gray coming in, please.
Thank you, Chair. Lots to admire about the budget for children's here, but I've got one small bit of detail, which is under 19.27, which is the unaccompanied children. So 67, I guess, is the limit of what the government has set. That's what my understanding anyway. So given the policy changes that are coming in, it's sort of end of term for national government, and they seem to bring out policies every 5 minutes. The risk of, well, two things really. Risk of them changing the ceiling and us not having the money. Or secondly, you mention in here about the sort of support services that go with that. Would those costs necessarily come down as they get further integrated? So I'm thinking of people that have learnt English and, you know, we're looking after them. But have you mapped that at all in terms of what if they move it to 85, or what if the costs get squeezed? And have you got any contingency in that? It feels like we don't have control of that to any degree, and I'm just making sure that you've got some contingency there. Thank you.
Thank you. So I would certainly agree with you that it's been a moving target. The National Transfer Scheme, and particularly the challenges that Kent are facing, means that we probably receive a weekly communication about the level of need and the requirement. We have made a commitment as a council to meet our requirement. I have to say not all councils have done that. It would be helpful if all did. It would certainly take the pressure off the rest of us to take more. So I always make that kind of call for all councils to meet their requirement, and things will be easier. You're right, if we were able to have more and more of our children integrated into Dorset, so again, another plea really for people to open their homes to these young people as foster carers or for supported accommodation later, we would see the costs come down. The costs for us in this are clearly exacerbated by our children needing to be placed in other parts of the country, because just simply things like mileage and time exacerbate that. We have future-proofed the requirement in terms of the staffing a little. We have worked up, if it got to 1.2%, etc., of the population, what that might look like. And we would still, at the present time, be getting full cost recovery for the accommodation costs. I think in terms of the ability of our staff to respond to challenges, I would just want to take the opportunity to thank everybody across the partnership who have responded so effectively to Camp Chickerell. There are a number of hundreds of children going through Camp Chickerell in the last few months. It is quite extraordinary. I was just watching a video this morning of the children taking part in an arts and crafts class yesterday with some of our locality staff from the Chesil area. Extraordinary work with those young people to settle them in their temporary accommodation of Chickerell before they go on to their more permanent homes. I'm incredibly impressed by people's ability to step up and help and lean in. And we, of course, will be making sure that we draw down any funding that is available in doing so. But firstly, we step up, we lean in, and we help out, because in itself that has avoided to date any high-level issues in that camp. So I'm confident that our services are really good at that. They're really good at responding to challenge. They're really good at getting together with our partners, and our voluntary sector colleagues help out with all of that where they can. And we'll continue now with the dedicated unaccompanied asylum-seeking children's team to be able to really make sure that our strategy going forward is future-proofed.
Yes, thank I think the key to your sort of budget management is you understanding cost per pupil. Whilst it's not nice to just talk about the cost per head because they're real children, I think that is the real key, and I think other departments should follow that lead. Is the cost of the unaccompanied asylum seeker children included in your sort of averaged cost per child?
The answer genuinely is yes and no, so we look at both. It's really important with that level of new population that we both look at the performance for children in care with them and without them, because it does absolutely skew our performance. So we look at both, and that way we can make sure that we're still on track.
Can I just ask a question on that as well? At what age do we have got legal obligations to the unaccompanied children, and what age do we keep an eye on them for?
So the unaccompanied asylum-seeking children have exactly the same rights, responsibilities and requirement for resourcing as any of our other children in care. So up to 18 for care, and the care needs to be of the same quality, standard and assessment by Ofsted as any other, and up to 25 for care leaving, or at the point in which their status is determined. But yeah, so it's exactly the same. And they have similar but different needs, and I think therefore our dedicated team understand that. So many of these young people, as you'll appreciate, have experienced trauma from their journey and their experience of being an asylum seeker, but not necessarily trauma from their family background, and therefore the way in which we respond may be different to our other children in care population. But other than that, they have all the same requirements in terms of health assessments, education support, all of the rest of those things, which clearly are not full cost recovery for any local authority or any local authority partnership. The only thing that is full cost recovery is the accommodation costs. So as a partnership, we work to think about these as a new part of our demographic, a new part of our community. And increasingly, as that percentage grows, they will simply become a new part of our demography.
Okay, that is really good. And once again, I hate talking in numbers when we're talking about children. We've got 69 at the moment. How many are we anticipated getting within the next year? And have we got funding available for them to take them up to 25 and cover the additional help that they're going to need?
So as they turn 18, we receive new referrals. So the National Transfer Scheme will send us new referrals at any point in which we're not at our level. So that 69 or 67 today won't be the same 67 in 6 months' time because they'll have turned 18. And our care leaver population is growing at about the same number. So our whole care leaver population is now over 500 young people. That is a very large population of care leavers, and it's something that we are absolutely giving conspicuous care to this year in terms of the needs of those care leavers, which are various, as you'd imagine, and particularly the needs of unaccompanied asylum-seeking care leavers is simply going to grow and grow and grow. We tend to have been taking older young people, 16 and 17-year-olds. They tend to be males. They tend to be from certain groups where they want to clearly be with communities that are like them. And so we tend to be kind of seeing and thinking very creatively around how do we work with those young people where they want to be. So the funding is as the funding is, which is about accommodation costs. It isn't about the costs of caring for or supporting those young people. That is costs that we have now budget built into this budget in terms of the staffing.
Thank you very much. I've got one more question about paragraph 2112, which is talking about the funding for the high needs block. There was a threat at one time that the overspend would come into our budgets, which that has gone away now. But although it's been deferred to 2026, and I'm sitting there going, if that hits as in 2026, we're going to have a real problem unless we've actually sorted it. Would you like to comment on that? Because we're looking at a lot of money there if they put that into our budgets.
Chair, I'm going to give my distinguished colleague, Mr. Aidan Dunn, the opportunity to respond. Thank you.
shouldered.
Teresa, thank you for this opportunity. Yes, as we've made clear in this budget, this is one of the most significant financial risks that we face as an authority. We are not on our own in this situation. It's a national issue. And as you've quite rightly said, at the moment, there's a statutory instrument that means we do not have to account for the overspend until April 2026. So based on the current regulations, if at April 2026 the statutory override falls away, then we'll have a significant debt. If we do nothing, we'll have a significant debt that would appear on our balance sheet and really threaten the finances of this council. And as I say, this is not restricted to Dorset Council in any means. So therefore, we need to be doing everything we can from a financial perspective to be improving that situation, but frankly, more importantly, for the children's perspective as well, to provide them with the special educational needs that they need. So that's why, as an authority, we've invested significantly in capital. We've set aside £40 million or so a couple of years ago to develop the capital programme to build more capacity for children. Just last week, we put in a further application of funding to the Department for Education to try and secure a further £14 million so that we can build sufficient capacity around Dorset to support those children. So the programme that we've got to tackle this issue is one about providing sufficient capacity in the right place. And then aligned to that, of course, is the recruitment. So this is very much driven by the needs of the children, but if we get the strategy right, then that should start to, first of all, contain the increasing overspend and then start to pay down. And this is where the safety valve arrangement comes in with the Department for Education, who, in recognition of the plans that we have, are contributing to the paying down of that deficit. Now, we, with many other local authorities across the country, are struggling with the plans, and we've rehearsed that a number of times in cabinet meetings to explain what's going on, and we continue to be in conversations with the Department for Education about that safety valve programme. So it remains a risk to us financially as a council, but the main thing is to provide the right provision for those vulnerable children across Dorset. Thank you.
Can I just come back on that? Because I haven't checked up on the background of this, to be quite honest. But the DFE gave us a chunk of money a couple of years ago, but there were very much strings attached to it. And there was also clawback within it if we didn't come up with what the DFE were asking for. I just wondered where we are with that, because it was quite a significant grant that they were giving us, and whether there's any clawback on that. And also, what are we looking at for these sort of figures at the moment?
Okay, thank you. Yes, the arrangement with the Department for Education was that they would contribute on a phased basis over a 4-year period, I think just over £40 million, £40 million. So far, they've given us around about 20 million. Within the agreement we have with the Department for Education, there's no clawback mechanism, so we're not expected to have to give money back. What we need to do, as the plans aren't quite progressing in the way that the Department for Education was expecting in terms of, as you say, the strings attached, so they haven't given us the next instalment of funding yet, and we're currently in negotiations with them to revise our plan. And as I say, many other local authorities are in a similar situation. I think later on in the report, we do mention the scale of the number. Have you got? Yeah, so this is paragraph 9.74. Okay. So, sorry, that's so we reported previously in the Cabinet paper the current predicted level of overspend for last year was just under 20 million. So that's the sort of scale that we're looking at.
Councillor Gray, please.
Thank you, Chair. In its own paper 13.44, the sort of forecast debt for this area is 45.8 million. I'm wondering, given that you've highlighted that the cliff is coming in 2026, whether we should provision for this in reserves. I'd like a comment on that, please.
Yeah, thank you. And it's a discussion that we've been having quite considerably about provision for reserves, and we certainly will be exploring in detail the reserves at the Place and Resources Committee next week. From a financial management perspective, I think we should be starting to increase our provision in anticipation to offset that risk. I think the issue, therefore, is how do we support those reserves? We know how tight the budget is this year, so it's going to be difficult to take funding from next year to set aside for reserves. So I think it's going to be more of a matter of repurposing existing reserves. And so this is the balance we have to strike. It fits into with our risk management approach. Where are the biggest risks, and therefore where do we set aside the money? On the other hand, I think from one of the discussions going on nationally is such as the scale of this situation across the country is that a number of authorities haven't got the level of reserves that we have. And so come April 26, there are a number of authorities would immediately be declared insolvent, Section 114. So there's a sense that there needs to be a national solution found to this as well. Historically, or the whole approach here is this is a national policy and we get ring-fence money from government to fund special educational needs. And the issue is, for us, we're spending more than that ring-fence. So one of the challenges we have is, should we be using local taxpayers' money to support a national policy that should be funded nationally? So there's a number of angles that we're exploring. From a purely financial risk management basis, I think we do need to start repurposing reserves to offset that risk. Whether that's the right thing to be done from a sort of local taxpayer's perspective is part of the conversation. So perhaps not the clarity of answer that Councillor Gray would want, but that's certainly some of the conversations we're having.
Is that okay, Councillor Gray? I find it all quite worrying because regardless of what's happening across the country, I'm interested in what's happening in Dorset. And what I'd rather have is reserves being built up for that, just in case. If this was my own personal finance, that's what I would do with it. I wouldn't just keep my fingers crossed that the goalposts were going to move. And as I say, it is the other scrutiny committee to take that up, and we've got the chair of the other scrutiny committee here today, and I wonder if I can pass that over to him, and we'll bring that up and discuss more in detail next week at your committee. Is that okay, Councillor Bartlett? Thank you. Have we got any other questions? Councillor Ezard.
Thank you. It's about a new homes bonus. I've just been reading the first magazine from LGA, and it says in here that the LGA welcomed the confirmation of a provisional of £291 million for 24-25. Now, how is it that in our new homes bonus, it's been gradually going down, but I thought it was all to do with how many new homes we were providing, and therefore that was a part of what the new home bonus was. Now, am I a bit mystified by that and don't understand it? Could you explain, please?
Can I just come in? Can I hold that question at the moment? Because what I'd like to do is to finish this part on children so that I can release Theresa Levy from the meeting. So are there any more questions around children's service? Councillor Andrews.
Yeah, thank you very much, Chair. Last Budget Cafe, it was outlined that there was 54 or 57 transition savings from different departments coming in. I just wonder which of those 54 or 57, I can't remember exactly what the figure was, are children's going to enact.
Aidan? Okay. I think some of them are going to be within children's, but I think the vast majority are going to be elsewhere, and I think we do need to dig into them. And I've got transformation is one of the agenda items that I've got. So once again, I might have to hang on to that because I think we've covered children's quite thoroughly on the transformation. So if I can hold your question till we come into the discussion on transformation, that would be great.
Yeah, thank you very much, Chair, but I was just concerned that those 54 or 57, I can't remember the figure now, haven't been identified and how we're going to measure them.
Okay, thank you. Councillor Quayle?
Thank you, Chairman. It's not a question, but just some thoughts following what Teresa has said, if you don't mind, if I just take a few minutes. And I would like to thank Teresa and her officers for that, and of course express to this committee, the Scrutiny Committee, in my role as cabinet member since I've been in post. A lot of the questions that have been raised here, or thoughts or concerns, have been taken up with Teresa and her team. And I appreciate the in-depth time that she spends with me when I challenge her on points, and of course which comes up here. Just some points I wanted to make through the bits that have been said, and just observations from my side. I found it rather unfortunate, the wording guesswork. There is no guesswork in this. There is quite a lot of worked experience. Teresa and her team look at prevention. Prevention is turning around quite a lot of this work, and that goes through every theme here. So there just simply isn't guesswork. There is margins that we work to, of course, but this is really calculated and worked through properly. And touching on that, talking about, and some of the last points that were just made about transition and stuff like that. Well, children's services, as you will see, have been going through quite a transformation, really, for some time. The locality model has been a fantastic model that has been brought in and is delivering that work that can then get into prevention, which is then saving us those costs going forward. And all through that theme has been made up there quite clearly, I thought. Everything is planned and worked out, and we hope for the best, but we absolutely plan for the worst, which is a sad thing to say within children's services, but it's the reality we live. And if you look at those budgets, questions were asked earlier about have we met those budgets, etc. Well, they have been met, and when things have come up in those previous years, they have been dealt with, and we are on track, absolutely on track, and I'm convinced that we'll be on track going forward. We talk about the birth to settled adulthood, and our position going forward with the new position that was mentioned, and I know Councillor Ireland raised this about a substantial package for a position. Absolutely, and if you look at Dorset Council is actually well placed amongst other like-for-like councils, and that's the important thing here. We've got 450 services that we provide, and we need the personnel and staff to do that. And it's unfortunate that I've read recently that someone just wanted to come in and knock off a few hundred positions here without having any understanding. We need to make sensible decisions, and we also need to tell our residents sensible things and not make things up. Going into the future, about the policies that may come down the line, Teresa was bang on there with Pathfinder, talking about those policies. Teresa and her team are designing those policies, or at least testing those policies out for future government to look at. Again, we've spoken about the transfer scheme, and we work through that, and that has been built into the base budget. Absolutely, looking at what we expect to come down, looking at what we know will come down, because we know, Teresa always talks about, we know our people and we know what's happening, and that's how we work that going forward. And then absolutely going on that last bit that I know Aidan has touched on, and it is a concern, it is something I pay close attention to, particularly on the area. We are doing everything we can, and it has been noted that Dorset Council is investing in that capacity. And I think that's how we're dealing with our budgets going forward. Thank you, Chairman.
Thank you. Right, what I'd like to do now is to move forward onto the sort of plan that I had for this meeting. So thank you very much, Teresa. Your answers were very fulsome, and I really appreciate them. And we'll take those comments back through to Cabinet. If we can move on now to, I've suggested that we have a discussion on fees and charges. Just for the public, there are a number of areas that this council gets money from. One is obviously the council tax, one is grants, but we can also have got the ability to make money by charging for our services. And this is something that I really wanted to drill into and make sure that we're maximising that sort of funding. There's obviously the things that you would expect that come in for fees and charges, the sort of general run-of-the-mill stuff, but I'm looking specifically now at adults. We've had a look at children's services already, so I want to look across and challenge some of the assumptions that we're making on the fees and charges. I don't know whether, Aidan, did you want to add anything on fees and charges, or can we go just into the debate?
I think it would be helpful to go straight into the debate. I know that colleagues in adults and housing are well prepared.
Okay, thank you. Would adults and houses like to comment on income generation for us? Sorry, fees and charges.
Thank you very much, Chairman. Yes, indeed, we would. And as Aidan said, the officers are here in the room, and also there are some on screen. Vivian and Andrew are both on screen. And I know that John Price here next to me is going to talk around the fees and the charges part. And Julia.
Thank you. Actually, I'm going to pick this question up, if that's okay, on behalf of Adult Social Care. My name's Julia Ingram, and I'm the Corporate Director for Adult Operational Services. So we have charges and generate fees from client contributions in a number of service areas. I think what's really important for members to understand is that we are not permitted under the Care Act 2024 to profit from making charges for care. We work really carefully with members to make sure, therefore, that charges and fees are set appropriately, and we are guided by some of the regulations within the Care Act in terms of how we assess people's personal contributions. Income and charges have been inflated by 5% in the budget assumptions, and we do recharge all the care through services, for our services, through, as I say, a client contribution process, which requires service users to be assessed on the basis of their means and their income, and leaves them with a maximum ability to pay. And that we have a specialist financial assessment team who help us to determine that. But again, there is little room for flexibility in that space because the rules, as I say, are set out specifically under the Care Act. I can go into a little bit more detail, if it's helpful, about the income levels that we generate. So in 2023, our income increased by approximately 10%, and actually Dorset Council, compared to both the national average and other partners in the southwest, generates a higher than average income. Our income is about 14.4% of our gross expenditure compared to an average of 12.3%. Now, there will be lots of things that sit behind that, but that does mean that Dorset it has as good a position as I think we can currently get. And we recover approximately 28% of our expenditure in service user contributions. Is that helpful, Madam Chair?
Yes. Can I go to questions on that? Has anyone got any questions on our fees and charges? Okay. Councillor Ireland.
Yeah, thank you. I was just looking for clarification. I think it's page 88, Appendix 1D. It's basically the the budget position and then changes for 24, 25. So the fees and charges income is shown as 1.7 million. So that's the increase you're expecting in income. Yeah. Okay.
Okay, I'm trying to get my head around this. You keep saying that we can't make much money out of this because of the Care Act. And I understand that there's an awful lot of vulnerable people who are entitled to free healthcare from us. But there are also a huge number of people who are not entitled to free healthcare, who are self-funders. And how much of that market can we get into?
Yeah, so, I mean, our market share, the amount the council buys on behalf of people who've been Care Act assessed is quite small. So in terms of the residential nursing market, we buy about 25% of the available beds, about 50% for community-based services. So at the moment, self-funders can be guided through us for our information and advice, and we do offer services to help them find appropriate care, but we don't actively broker on behalf of that group of people. The reform agenda for adult social care, as you may remember, did look at this aspect of change, but unfortunately that has been pushed back for a number of years at the moment. So our activity really is to buy care for those people who we've actually assessed in the first instance.
Okay, so can I come to Care Dorset and the funding for them and whether we can have an income from within that can get passed to the council at some time?
Yeah, so Care Dorset obviously set up just over a year ago. We've had 1 year's worth of trading, some really positive aspects of performance improvement against a contract which is worth just over £26 million worth of our money. So the focus over the last year really around Care Dorset has been maximising the value through that contract, which we are very pleased with that performance. We're at the stage with Care Dorset now of bringing together a 5-year business plan. So there are opportunities within that to look at income from the wider market. The TECL arrangement that's in place for Care Dorset does allow trading for up to 20% above the contract value. So that is something that we are working on at the moment. But obviously, the first priority was that safe and legal transfer, which I'm pleased to say has gone very well. And certainly now we are working with Care Dorset to look at what those opportunities might be.
Okay, so you talked about a 5-year business plan is being written for that. When is that likely to be available?
So at the moment, we've just started that process. We would obviously like to bring that through the overview function. We would want to engage on that piece of work. So I would imagine in the next few months that we'll be in a position where we start to be able to present some of those early ideas.
Okay, and could I have some assurance that there'll be targets in there for income generation? Because I think looking at the financial situation of the council, we've got to seriously start looking at income generation right the way across. And I understand children's services are fairly limited on where they can increase their income, but I think there is quite a lot of capacity with a bit of imagination within adults that we can make quite a lot of increased funding.
Yeah, absolutely. The assurance is there.
Thank you. Councillor Cook.
Thank you, Madam Chairman. Robin Cook, Stour and Allen Vale Ward. This fees and charges, I mean, I know we're compartmentalising this morning. We're looking particularly at adults now, but I think what I'm saying applies to the whole authority. I think to members, this is really a mystery area. you know, I think it crops up with regular monotony on reports, but I think very few of us are aware of exactly what fees are there throughout the piece and what the charges are. And if that's the case, are we being entrepreneurial enough out there in the wider world to draw those additional fees in or sell those services? This is what worries me. If we don't know about them as members, or maybe it's me, maybe the other members are very professional on this and maybe it is me, but I don't think it is. Whilst I accept the figure of 14% now, we've increased on adults, which is good compared to the national average, but that's not the level we should stop at. We should be looking at maybe 20% or 25% of ways of doing it. Now, it's easy for me to sit here and say it, but I don't think we make the wider world aware of what we can offer to generate that additional income, whichever way we do it.
I think you're absolutely right, Councillor Cook. It was interesting. I looked on Dorset Council website the other day because a lot of our fees and charges are on there, but I couldn't find anything for adults, which is why I wrote and asked for some more details on what we do. So whether we need to start advertising ourselves and pushing ourselves a bit more, this is the only way we're going to bring down our income tax and retain services, is if we can put up our income generation right the way across. And I'm not just getting at adult services at all. This has got to be something that we've seriously got to look at, and look at income generation possibilities across the council. I don't know if you would like to comment. Okay.
As John said, where we can be dynamic and look at income generation, we do. But when it's related to services directly provided to service users, as I said, we are limited by what we can consider in terms of making a financial assessment around their contributions. Now, approximately 76% of all of the service users that Dorset Council directly provides a service to pay a contribution and a charge to their care, and that is based on their ability to pay a fee. Those people who don't are because they fall below the minimum income level, and that we can charge. And as I say, Dorset as a benchmark stands really well against the national standards for income generation. So other than that routine increase, and as we've funded in 5% this year, we are really limited on direct income generation from client contributions.
Yeah, if I could just come back on that, just to be clear, I'm not trying to increase the income from very vulnerable people who cannot afford it at all, but there is an awful lot of wealth within Dorset, and there's a market out there that could well be tapped into. Sorry, I've got a Councillor Gray, and could I just go over to Aidan first, please?
Thank you. If I could just respond to Councillor Cook's comment, and can I draw members' attention to Appendix 1, which is on page 84 and then onto page 85. So the point being, how much do we look at income within the council? What Appendix 1 shows us, the middle column labelled fees and charges, is that our proposal next year is to generate 176 million pounds from fees and charges across the entire organisation. So this is absolutely, as Councillor Cook says, a really significant sum that perhaps we don't always pay the attention to that we should. Now, those fees and charges, as we can see from the table, range simply from library fines through to car parking charges, through to charging for adult social care, as we've just described. So there's a whole range of rules and regulations around it. Some of them can be entirely market driven in terms of we make our judgment as a council of what the appropriate level, and some of them are highly regulated by statute, as we've just discussed in adult social care. But I think one of the things the council has to decide sort of philosophically, and this may be a point that Councillor Gray comes to, is, what is the approach to charging? Should we be charging as high as possible in order to sort of try and reduce the pressure on council tax, or should we be just looking for sort of a middle of the pack? So there's a degree of benchmarking to be had there as well. I think, and then when we look at individual items, and I'm careful, trying not to go there, but we know about the controversy around the car parking charges, for example. So it is a broad and wide-ranging topic, and it's certainly one we could bring back to scrutiny. It might be a better place for place and resources scrutiny from an overall perspective. But I think the point about income generally as a council is well made, and something that we could certainly look from a finance perspective to put more emphasis on in our quarterly reporting. Thank you.
Thank you. It's interesting that you mentioned car parking charges again. And I'm hoping that Councillor Bartlett will be taking that up, because I notice there's a 5% increase of income proposed from that, which would either be from additional money coming in or increased usage. I don't know whether Councillor Bartlett would like to comment at the moment.
Thank you, Madam Chairman. Yeah, I would highlight the fact that while we will obviously have I suggest a conversation around that within the Place and Resources budget meeting, I would remind members that there will be the opportunity for that car parking charging issue to come back to scrutiny anyway, to be debated within scrutiny at a later date. What may transpire from that, it may be that it need to be sent back to the policy committee to have another look at that before going to cabinet for approval. So I do not want the Place and Resources budget scrutiny meeting to get bogged down with car park charges, because that is our work programme anyway going forward. Thank you.
Thank you. Sorry, could I just go back to Aidan, Councillor Gray, if you just bear with me?
Conscious, as Councillor Bartlett has just said, but I just want to highlight paragraph 19.36 in the paper, that there isn't the proposal is not to increase car parking charges for next financial year. There's paragraph 19.36, note B, just to be very clear. Thank you.
Thank you. Councillor Gray.
Thank you, Chair. I wasn't going to mention car parking charges. I think I've done that to death. It is interesting, though, that we've reduced the budget this year for car parking to a more realistic level and taken 4 years. Anyway, I think just a comment on income generation, which you know is my passion. I think income generation is tricky for councils because we don't have the competence, and that's not a slight on officers. We just have not acted, or councils haven't acted in a way that is income generational for decades. And I think there is a piece of work that isn't about fees and charges, but it's about culturally, where is the line for income generation? Because ostensibly we are a service provider for our residents. We're not. That's our primary function. But there is a need, I think, to look at, because we're good at some things and we should charge, and Aidan knows this phrase because I've said it to him many times, we should charge in some cases a Dorset premium for some of the things that we provide because we're the best at them. I don't think that's across the board. I think we need to take an a la carte sort of look at our fees and charges and decide what the market is doing. So more market intelligence, more benchmarking, and more training probably because it's not natural for officers to act in most cases an income generational way, because they provide services, which is what we ask them to do. But you know, this is my passion, and I think there's a balance to be had, and it is tricky. My question was about adult services, and again, I find myself saying the same things about the adult and housing services, which is there's lots to admire about the budget in here for adults. My question is, I want to detail again around, there's a sort of 7.2 million increase in funding this year, and it's offset by a range of savings, which adds up to 8 million. The one I want to focus on is the market management, which we're claiming is going to save us £5 million. And I'd just like a bit more detail, because that's sort of negotiational, that is sort of income saving. I just need a bit of confidence that we can actually, because as we learned from Place last year, we make promises about saving and we don't save, and that's a significant number. Thank you.
Thank you, Councillor Gray. And I thought you might ask that question. John is going to go into the detail for you on that.
Yeah, I mean, I think I'd probably start by saying that as a director, we've got a really good track record of delivering our savings. So, this year we have pretty much delivered the full amount. We're at 90%. We've got, the last quarter to go. So I think there should be good confidence levels about the work that we do, and indeed the way that we scope the savings. So the design of those savings, does follow a lot of detailed data analysis of demand, but also price. So this particular saving of £5 million is around market management. And as a commissioner, I'm very confident we can deliver that. Reason being, over the last few years, we have invested quite heavily in our care markets. So we were an early adopter of the fair cost of care approach. We were the first in the region to take that, which meant that we invested both our own money and some of Health's money in the market. And over the last few years, we've certainly seen that investment has materialised in sufficiency of care, and most importantly, the right type of care. So, you probably heard me say a number of times this time last year, we were worried about home care and would we have sufficiency, and this year the answer is we have, and that's really positive. It doesn't mean that there aren't challenges in the marketplace still. There are some significant challenges, as you'll see from neighbouring authorities. And as Teresa talked about, if we get this wrong, these budgets, demand-led, are considerable and could drive to overspends in as you've seen in other parts of the country. So I think the confidence level is very high because we've already invested. We have a lot of our providers on our recognised frameworks, which means that we can control those uplifts to a degree. There will be providers who will ask for additional, but again, where that is the case, we will take it on a case-by-case basis, and we'll use the full depth of the council's expertise in that, and channel anything over and above through our commercial board. So we have some very positive processes in place. We have a positive market at the moment. We also will invest this year in the market again using the market sufficiency grant that comes through. So we are not investing, but we are using the investment that we are receiving through the recognised grants for adult social care. So high level of confidence personally. We have ragged that sort of as amber at the moment, but I think given our track record, we are confident. Thank you.
Thank you. Yes, my only ask would be, given the other details of the savings, working age accelerator, home first accelerator, they are very specific. For report going forward, I'd like because it's £5 million, I'd like to see a bit more detail or just a few sentences about how you go about that. Maybe break it down, maybe just 2 or 3 sentences so that it's explainable. That's all. Thank you.
Okay.
Yes, more than happy to do that. Yeah.
Councillor Cook.
Thank you, Madam Chairman. Just to come back really on my original point in question, I felt a bit awful because I understand with adults the difficulty, and it wasn't really, it was a question asked, I think, generally about the authority as a whole, and I think I'm glad that the debate has sort of started a bit more on this now. It needs opening up, it needs drilling down a bit more, and I think probably place scrutiny next week maybe we'll take this on board and debate it, because I think it's a very important part. If I may, just for a moment, Chairman, if you'll indulge me for a moment, why I'm concerned about this, a bit like Councillor Gray, I'm a retailer by tradition, and I'm naturally opportunistic. Yes, if I can make some money somehow, I will do, in the nicest possible way. But anyway, 10 or 12 years ago, when I was on the old authority, Dorset County Council, one of the things we worked upon on a committee that I was involved with was to raise revenue towards upkeep of roundabouts and highway verges. And the principle there was to sell advertising on the roundabouts. In principle, Nick's nodding because he remembers this as well. I think he was partly involved as well. To sell advertising on roundabouts in the Dorset County Council area. Very good idea, and well presented by an outside organisation that were professional at doing this, marketing organisation. And we took it up, but we failed at it because we just didn't. I think it was too hard to do, and it went at the bottom of the in tray. And it was something which was so obviously, if you like, a simple way of revenue generating with a bit of oomph behind it. And I wonder whether we're still doing the same thing 10 or 12 years later, albeit with another authority name. That sounds a bit unkind, but that's the worry I have. We're not, push is not the right word, but we just haven't got that. Yeah, thank you, the commercial spirit. And I agree there are limitations, and adults, forgive me, I do understand how much more you are limited than other parts of the authority. So my apologies on that one. But I think the point's made. Let's have a bigger debate about it and see where we can go.
Aidan?
Thank you. Can I just clarify that? On your journeys home, if you come across a roundabout, you'll see there's a sign that says Dorset Council Roundabout sponsored by. So whilst we had an external provider come along and pitch for that work, we've actually resourced it with an internal member of staff who's very successful. So you'll see the vast majority of roundabouts in Dorset are sponsored, and we're just looking at a number. We'll give you a figure outside of the meeting about how much we generate from this. And the same individual is also looking to commercialise Dorset as a venue for film locations as well. It's all tied in. How can we make the maximum use of Dorset and its amazing natural assets as well? You'll see in a whole range of Netflix films and other films, all sort of channeled through our fledgling film unit. It's all about trying to take that commercial approach. I agree we can go further, and I agree we can be ambitious, but to say that we're not doing anything is not technically correct.
No, I appreciate that. And please, it wasn't taken that we're not doing anything, but I think the impression gained was that particular instance, it wasn't pursued in the way that it might have been to generate income. It obviously has improved, but the point is made, I think. And thank Aidan for that.
Councillor Jesperson.
Yes, thank you very much. I thoroughly support this discussion on income generation across the council. It's something I've pushed for a very long time, and I hope we'll take it up again in the place scrutiny, where there are even more opportunities for income generation. But I would just urge a little bit of caution on recommending too strong a focus on income generation in adult services. I wouldn't want to see very valuable specialist resource displaced for looking for income opportunities that might actually be really quite marginal. So I think there's a word of caution there, and I really wouldn't want a message to be taken from this or any other discussion that we might be looking at charging or increasing our charges to the 75% of the service users who are by definition vulnerable and who have already been assessed. So I do think a little bit of caution in how we urge adult services to look for income. There might be some income there, but I don't think that's principally what adult services is there for. Thank you.
Thank you. I just thought I'd have a final word for myself on income generation. One of the ways, and I've sort of agreed with all the comments so far, there is a balance. One of the ways that we can address Councillor Cook's sort of opening up of the sort of debate and agenda for income generation is to report it nakedly. It's quite, you know, we've done this at a town council level, but just report income as an income report. It is quite dangerous because you sort of hone in on there's no cost attached to it and the cost of delivering that service, but it does highlight, and you know, people like adults and housing, it is difficult to generate income, but there are other departments where, you know, particularly place where you could generate significant amounts. So my recommendation going forward, and I don't know where we discuss this, but is to have a really robust quarterly income generation section in the finances, so that it has to be taken really lightly because you don't attach the true cost of the service, but it would highlight the amount of income that we do generate from roundabouts, because we should know that as councillors. Thank you.
Thank you. Can I just go over to Aidan, please?
Thank you. So on the roundabout point, we generate £152,000 a year. We've just found out, thank you. And the fact it's taken us a little bit of a time to find it is sort of emphasises the point that Councillor Gray has just made. So we'll look to enhance our reporting in the quarterly finance reports. It's a good, strong recommendation. Thank you.
Thank you. And Councillor Ireland?
Yeah, thank you. I guess we probably need to close the fees and income generation, but just for clarifications, we've heard that it's difficult for adults to generate income, and I think it's clear that probably the best way for this is through our single ownership of Care Dorset as the sole shareholder. It's been mentioned that we benchmark well against other councils with regard to income. I think I'm looking for clarification. That's purely a function, I think, of recovery or charging people. So it's essentially saying that people in Dorset are better off, I think. Is that fair to say? Or we have more people in Dorset have more money, so therefore they pay more in charges. Is that true or not?
That certainly is a contributing factor.
Okay. Sorry, Councillor Somper.
Thank you very much, Chairman. Yes, absolutely, around Care Dorset, that is a vehicle, but obviously it's been explained well today. There's a restriction on that, it's limited. I suppose I'd also like to say that a lot of the focus is on reducing the costs for residents, and then obviously also for the council, and providing better value for money for everyone. So for those who are self-funding, and also the work that we do within the Directorate as a general, it's around the reduction. And that's a really important part as well, because that has obviously a huge benefit across this council, as it's a large chunk of the budget, but also for our residents as well. So I appreciate and understand the issues around that income generation and that vehicle of Care Dorset. It is limited, but where there are opportunities in there, they will certainly be looked at and brought forward.
Thank you. Councillor Azad.
Thank you. I would just like to mention that I think because adult service, social care is all about servicing the population, especially those that are elderly, it is important to know that, and I'm making a point, I'm making a statement more than anything else, that in that we do pay the staff and we retain the staff on a wage that actually is, I know, that is above the living wage. And I think this is what's important, that we have a career a passage for all the staff, and that we retain staff. And I know that they're in Dorset, we're trying very hard to actually maintain and grow our staff and keep our staff. And I think that's important in the service industry, that for all the population that we have, an elderly population, that these people actually have people that are regular to them and they don't have changes of staff all the time. And it's so important to people in that industry, and especially with now Care Dorset that we've got with this service company, to actually make sure we nurture and get behind it, because I think it's very important. And if they, as John is saying, that, and I would like to congratulate him on his new post, that actually we actually go forward and take part in be able to be part of this business case for the next 5 years. And I think that's very important, that members actually become part of that. And I think income generation is very, very difficult in the service areas of the council. Thank you.
Okay. Jane? Sorry, Councillor Somper.
Thank you very much, Chairman. Thank you, Beryl. And you've obviously been involved in conversations, as has Councillor Ireland, and understood from the very beginnings of what Care Dorset was about and what it was set out to achieve. And you were, both of you, very much part of those conversations. I know that there's a visit arranged for you to one of the units, and I will be coming with you, and I look forward to that. And also the attendance of you, I hope, at the next shareholder board meeting, where you will be able to further contribute to this service. Thank you.
Chairman, I really welcome the fact that I've requested that I go and see a reablement home that's now in Blandford, and also the fact which actually takes patients out of beds in hospitals and has a reablement before they go home, and that actually has saved such a lot of beds and angst for the hospitals. So I'm going to go visit in February. But also that it's very important that if people want to, they can actually observe on the Care Dorset, committee, so that you can see what's going on. Thank you.
Okay, thank you very much. Did you want to come in, Councillor Andrews? You didn't. Okay, so I want to wrap that part up now on fees and charges. And I think the feeling that I'm getting from the committee is that we'd like to put this forward as a suggestion to Cabinet, that we look in more depth at fees and charges going forward and leave it to them to sort out a mechanism for us to do that, whether that's going to be through the overview committee or some other mechanism. Will be up to the Cabinet to decide. If we can...
And also the suggestion of some kind of regular reporting of income from fees and charges.
Yes, I can see Aidan nodding his head frantically at the back. So yes, we have picked up on that one. Very quickly.
Thank you, Chairman. Yes, also the breakdown of the market management as well, that we'll be able to provide.
Captured all of those, and we'll take that forward. I want to move on to transformation, and I'm also going to put that in with our future council as well. So I don't know whether Aidan wants to comment on that or whether we just go straight into the debate.
Thank you. If I could set the scene, because I appreciate this is going to be an interesting discussion. I think, first of all, our approach to savings and transformation across the council over the last 5 years has achieved significant financial impact. So we describe how the budgets that we look through this process over recent years have cumulatively saved over £100 million. And what that means is if we hadn't have done that work, we would be seeking to spend £100 million more than we've got available, and we'd be in a similar situation that we see our nearest neighbours in Somerset in at the moment. So there's a degree of, I think we should take a degree of confidence and indeed pride about that work. So the next bit I want to talk about is there's two elements. Within the budget you have in front of you, there's £18 million worth of sort of more detailed savings, which you've already been exploring and very helpfully. But in addition to that, we've got 12 million, which we called Our Future Council, and that is sort of unspecified, and I suspect that's an area you want to explore. But I just want to set the context for that. The point being, having gone through a very challenging budget setting process, identifying £18 million of efficiency savings in the context of not cutting or reducing frontline services, there was a sense from officers that the 18 million was as far as we could go in the time available at this point. If we needed to identify a further 12 million right now, we think that would be it'd be too difficult to do without potentially having to cut services for our residents. And that's something that's very clearly that this administration does not want to do. So what that means is that we are actually in the fortunate position of having built up our reserves over recent years, that we're able to buy ourselves sufficient time and financial confidence to properly rethink and reimagine the council as we move into the new term post-election. So in November, at November Cabinet, the Our Future Council programme was launched with the description, I think I remember at the time, that sense of think the unthinkable. Let's really think what, having established the council, got it up and running, what does a future council really start to look like? And at the heart of it is one that provides increasing value for money for the taxpayer, but there's also one that's closer to the communities and our partners and to our residents, one that makes innovative use of our assets, and a council that really embraces new technology. And that new technology will provide better service for our customers and our residents and allow us as officers to operate ever more efficiently. So that programme, that 7-year Our Future Council programme, it's really significant for setting the tone and the direction for the next term of the council, as it were. But as a consequence of that 7 million, attached to it is the need to identify £12 million worth of savings for next financial year. But we haven't identified those specifically yet. And that puts, and this is obviously an area you'll want to look at, but it puts me professionally as your Section 151 officer in quite a difficult position. How do we approve a budget with 12 million unidentified versus what confidence and assurance have we got? And I reference once again that ability that we have to have delivered in the past. And then on top of that is that as the programme's been developed, we are approaching an election, and any administration post-election, regardless of the outcome of that election, will want to have a very firm hand on this piece of work as well, because we are, of course, member-led. So what we're looking at in terms of these plans, and we haven't got specific itemised proposals, but what we're looking at this stage is themes. And these themes are about doing more of what we've done already, but doing it faster. And I'll give you some flavours of that. So we are thinking as an officer base, thinking about our structures and how that could lead to a different sort of council. And we take confidence if we look at, for example, what we've done in the past over recent years. We've insourced our revenues and benefits service, actually recruited more staff and got a better service for our residents, but overall lower cost. We're looking at our commissioning arrangements, how we commission services, and we've already heard great examples of how setting up Care Dorset has really helped improve the relationship with the market and our impact on the market and drive down costs. We're looking at alternative delivery models, how our services are provided. We want to, and we are talking to our communities about how we work with them collaboratively, and that's really important. We're looking at service redesign. So, for example, we've already underway is a review of the way that libraries work, and we've got a real direction of travel. And then finally, we've got a theme of asset management, and a good example is the last cabinet meeting where a series of assets were agreed for disposal, and at the same time we're investing in other assets to make better use of them, and examples of that came through children's services. So my point on this Our Future Council is what we're doing is trying to shape a council of the future, doing more of what we're already doing, more that we've got confidence in ourselves, but the point is we haven't got specific detailed plans yet. We haven't had sufficient time, and plus we want them to be developed by and supported by a new administration. So fundamentally, as your Section 151 officer, I'm confident that we've got sufficient reserves to underwrite the risk of not achieving the £12 million next year. But similarly, as the overseeing the transformation and change function of the council, I'm confident that the work is underway. But I think it's really important that whatever the outcome of the election, in 6 months' time or so, when the dust has settled, that we really do take stock of how are those plans progressing, what have we got in place, in set up to achieve the Our Future Council savings programmes. And if we're not confident in 6 months' time, in the autumn, about how those plans are progressing and being implemented, then we'll need to reconsider and take alternative course of action. Thank you.
Thank you. I think this is going to be the really interesting part of the debate. I've got several speakers waiting to speak. Can I go to David Gray first, and then, sorry, Councillor Gray, and then Councillor Heatley?
Deep breath. It's not very often I get to speak before Councillor Heatley, so I will take my opportunity. I've got a couple of questions contained in this, so this probably is the singular reason I'm not convinced about this budget, is my first point. And I'll explain why, hopefully, and I'm sorry this is going to be a bit rambling. Aidan's already suggested or already outlined for us that we've been fairly successful as officers and as councillors in making £100 million worth of savings. And we followed that strategy by setting a balanced budget and then chasing savings through the year. Most have been successful, some haven't. And that's worked for 3 years. That's been our budget strategy. Yeah, that's what we've done. This year, and that's worked for years 2, 3 and 4, although we've used reserves in those years to balance the books, we have been chasing savings. This proposal flips that on the head because it doesn't set a balanced budget and then chase savings. It actually builds an expectation of redesign and budget saving into the budget. Now, and I'm glad that Aidan's sort of given the 5 themes to chase it. So here's my issue. And actually, as a budget strategy, I'm more used to this way of achieving savings than the other way, because the other way, officers spend the second half of every year chasing savings, whereas at least we're identifying themes within that. So I'm very supportive of this approach, which may come as a surprise to Aidan, given the grief I've been giving him on email about this. But here's my 2 questions. The first one is, it started off at 15 and then became 12, which sort of suggests that we're making an amount up to make weight the budget. Because if it was 15 to start with and we found savings elsewhere, why isn't it still 15? If that's what we thought we could save. That's the first question. The second question really is, the last cabinet, I think the last one or one before, they authorised £2 million worth of capital receipts to revenue-rise them. I want to know whether that £2 million is going to be used to chase the 12, because then it becomes a net 10. But all of that, and I'll let Aidan comment on, but all of that pales in insignificance compared to page 59. Bearing in mind what I said about our strategy for 3 years and our change of strategy this year, the first point in the strategy document is we will not balance the budget strategy by using reserves. And it's disingenuous to say that we're doing that, because we're not. We've never done it. And you could argue in previous years that we didn't set out to use reserves, because that's the answer I got last year and the year before. We didn't set out to use reserves to balance the books, but we had to anyway because of those reasons that have been previously specified. But this year, we are actually specifying in our budget strategy that we will underwrite proposed savings. And that statement is disingenuous. Thank you.
Thank you very much, Councillor Gray. I think that last comment is really well made. I suspect just about everyone around the room has got this sentence highlighted. I certainly have, and so has Councillor Ireland. I don't know whether Aidan wants to respond to that, or do you want to take more questions first? Well, actually, would you respond to that, please, Aidan?
I was hoping that if we could hear a range of questions, it would give us time to marshal our thoughts and make a sort of a helpful response, if I may. Thank you.
Okay, I don't want to lose any of the questions that were within Councillor Gray's comments. If, Councillor Gray, you can keep a note, and if anything is not responded to, then come back to us. Councillor Heatley.
Thank you, Chair. Brian Heatley from Robwell and Wyke. Councillor Gray has said quite a lot of what I would have said. I'm not going to say the same things again. I'll refer you to the sentence that's right near the beginning of this budget strategy paper, which defines a balanced budget. A balanced budget is essentially one where all expenditure is funded by income without unsustainable use of one-off or short-term sources of finance. Now, we have in Appendix 1 a long list of all the expenditure we're planning to make next year, and we are pretty confident we will be spending at least that. That's our previous experience. Those numbers are pretty firm compared to everything else on that page. Is funded by income. The Our Council programme, by any stretch of the imagination, is not income. It is a programme to produce costs. It's there in the budget as a negative 12 million figure in the central finance lines. But I don't think that's income. If I was at work and I went to my boss and said, I'd like you to increase my income, please, and my boss said, okay, you could spend less on various things, I think I would regard that as a pretty poor answer. So I don't think we've met that test unless we spend some of our reserves. And my belief is we will spend some of our reserves if we have this expenditure programme. I think that there is a separate discussion to be had about how sustainable that expenditure of reserves is. My belief is that this is a council that's sitting on large numbers of mainly non-financial assets, land and buildings, and that if we mobilised the money there, we could probably go on doing this for quite a long time. I don't know how long unsustainable is, but I think we can get over this for a year or so, and in the present circumstances, I think it's an extremely sensible thing to do. So I think we should be straightforward in setting the budget. We should say we will spend some of our reserves. We expect it. Oh, by the way, we've got a programme to transform what we're doing, and we may manage not to do some of that. But I think that is a much more straightforward way of presenting the position. I think it is particularly the case that it is more honest and straightforward when we heard from Aidan today that they couldn't find the 12 million, our officers couldn't find the 12 million without reducing some of our services. And that makes it, I think, much more important to be very straightforward with this. So I don't think this is a balanced budget as it's presented, and I probably at the moment would wind up voting against it on those grounds. Thanks.
Thank you very much, Councillor Heatley. Shall I just take Councillor Ireland first and then come back to Aidan for a response on this?
Yeah, thank you. I think most of the points I wanted to make have already been made. It's basically not a balanced budget unless we use the reserves. I think the point is that Aidan mentioned at the very beginning of his introduction, we're looking at £30 million of savings, essentially, of which 12 million are unidentified, and hence the use of reserves. We're likely to use a similar amount of reserves this year, I think. We don't know yet, but we're looking at certainly a deficit in the 23-24 budget, aren't we? 10 million at least, I think. I think that the point I'd like to make is that 30 million of savings is probably the most in the, we've been going for 5 years now. This is the budget for the 6th year of Dorset Council. We haven't made 30 millions of savings in a single year. So it seems a bit of a stretch. Maybe we think we can make 30 million when we haven't made that before, and yet we have a lot less detail of how we're going to do that. Since this is adults and children's, I picked up on in the adults section. Basically the pressures are split into two, which is basically pay / income inflation, and then the other stuff. And the other stuff comes to around about 8 million quid, and then it goes, hey, look, we can save 8 million quid by doing this, one of which is 5 million through market management, but we don't know what that is really. And it just seems unlikely that we can do that, to be honest. It just seems, the fact that the two numbers balance each other out just seems convenient. And there's a mention of an adult 10-year programme, and I did a bit of research last night. I may be wrong, but I can't find anything that mentions what the 10-year programme is. Is this a new thing, or has it been going for a while? Because I couldn't find the detail of how it's actually progressing. So is that 8 million you're proposing to spend encompassed in that 10-year programme and detailed in that, or is it new stuff in addition? And my final thing, I guess, since we're on pressures, and I know the children's people have left, but on section 19.28, the words significant risk are used in terms of the transformation savings for children's, which probably says it all.
Just very quick, I'm going to hand over to John, but we did lay out through the budget cafes in detail our plans. But John will be able to add some more for you on that, Councillor Ireland.
Yeah, certainly we have plans that go beyond next financial year. We're always looking at our transformation plans. We're always looking at our demand. So our demand is quite key in recalibrating some of those transformation plans. But yes, more than happy to share the entirety of that programme that goes way beyond. I would just come back on the market management. I think we have got a clear plan on that. I've taken the point that perhaps there needs to be a bit more detail in the description, but confident on that as well. So we did cover some of that in the earlier cafes as well. So hopefully people will be reassured that we've answered questions on that. Thanks.
Perhaps also, Councillor Ireland, might be helpful to you if we send you the relevant slides that we used in that particular cafe, because I'm not sure that you were able to attend.
I wasn't at the first one. I was definitely at the second one. But it needs mentioning here because we're scrutiny. Members of the public were available at those meetings. So.
No, I appreciate that, but we can certainly get those to you.
Yeah, I think just for the members of the public who are watching, we have had a significant amount of information on this, but it's always a problem how this is public scrutiny, and this is our opportunity to look at these things under the public gaze, which is why we may well respond and come back to some of the stuff that is in the cafe to explore in a lot more detail. Can I just hold your question at the moment, Councillor Orell, and also Councillor Azad? I want to go back to Aidan for comments on this £12 million, please.
Okay, thank you. I'll pick up, hopefully address the themes and issues raised. I'm going to be supported by my colleague Sean here, who will introduce himself in a moment. So just to go back, I said earlier about the £100 million over the life of the administration, and we try and manage our budget, or we look at our budget on a long-term basis, so the medium-term financial plan. So we have to do long-term budget planning. That's how we ensure that we're sustainable as an organisation. One of the underlying themes of that is a policy of invest to save. And so in order to generate some of this £100 million worth of savings that I've spoken about, we've had significant investment ranging from in capital as well as use of reserves through our transformation fund. And that's very much part of our policy and approach, is certainly the intention that to generate this £12 million worth of saving is not going to be without a cost in itself. And so I'll draw Sean in on a moment to talk about how we intend to fund some of that transformation activity, which will address the point that Councillor Gray raised around the flexible use of capital receipts. But the first issue that Councillor Gray raised around 15 million and then 12 million, and in the context I'll just explain to the public, through the budget, the sort of private briefings we've been doing on the budget throughout the autumn and winter, at one of the iterations of the budget showed a budget gap of £15 million for next financial year. And then subsequently, we were able to identify an improvement in our collection fund, so the money we collected from business rates, and that inflation on utilities was going down. So so the inflation was less than we'd originally modelled. So those two factors meant that the budget challenge for next financial year reduced from 15 million down to 12 million. So Councillor Gray's challenge saying, is this just a balancing item on the budget? I go back to my earlier point. Our Future Council is a 7-year programme to try and reimagine the council and make it truly modern, as was outlined when the unitary authority was formed. As a consequence of that, we're looking for financial benefits. Financial benefits that we're looking for next financial year are now 12 million. So hopefully that addresses and clarifies the point that Councillor Gray made there. The second point that Councillor Heatley made about income and where the funding is sat at the moment, and would we be looking at income? I think what we've heard loud and clear for the conversations this morning is that income is an opportunity for this council that, as a committee, you think we should look into further. So by no means are we ruling out next year or beyond generating more income to help close that gap. So whilst it's labelled as a £12 million gap in the budget at the moment that's held in the central figure, if we're able to generate more income, that will reduce the gap. Similarly, if we're able to reduce our cost base, that will close the gap as well. So hopefully that helps address the point there. The next issue I wanted to mention was this fundamental issue of the principle one, thou shalt not use reserves to close the budget gap. And at times I wonder if we're fighting on semantics on wording, or actually is there a fundamental issue here? So what I want to be clear on, my interpretation, my personal interpretation of that rule of don't use reserves to close the budget gap means that we don't simply just plug a hole in the budget and that will be a reappear the following year and reappear the following year. What I'm saying is that we're setting aside sufficient funding to cover the risk of not delivering those future savings. So I'm not plugging that £12 million that is in the central line that Councillor Heatley has highlighted. I'm not making that disappear by use of reserves. What I'm actually doing is the very thing that you were advocating earlier around the high needs block, which is saying this is a significant risk. Let's earmark funding to cover that risk, but do everything we can to avoid that risk materialising. So you may wish to sort of debate the semantics, but I just want to be clear that in terms of our accounting treatment, we're setting aside funding to cover the risk. We are not plugging a hole in the budget with those reserves. And I'll leave you to come back to that. I'll now circle back to the other point that Councillor Gray made around the flexible use of capital receipts. So yes, a £12 million transformation programme plus an £18 million savings programme, we do have to invest to deliver those savings, and the flexible use of capital receipts policy is one of the ways that we do that. So if I could ask my colleague Sean to introduce himself and talk us through that.
Hi, good afternoon, everybody. My name is Sean Cream. I'm the Corporate Director for Finance and Commercial. So in relation to flexible use of capital receipts, the rules essentially that allow us to use that are that we must be using them to essentially spend on activity that's going to transform service delivery to reduce costs. So essentially what we're doing as part of the paper that was brought to Cabinet recently was to essentially to deliver some activity around one of the strands of our future council, which was asset management. We're looking to, the paper approved, confirmed use of up to £2 million of flexible use of capital receipts in order to drive savings in future years. The savings in the paper cumulatively deliver £2 million recurrent from 25-26. So that the progress on that and the kind of release of those savings will come through as part of the medium-term financial plan that will come through at autumn later this calendar year. So you'll get an update in terms of the progress. It's not offsetting our future council, albeit it is in a similar kind of space, and then it's looking at asset management, but it's not part of the 12 million that will come through separately. It was also previously outlined that we have, I think, just over £5 million of flexible use of capital receipts available to deploy for this purpose. And just before Christmas, as part of the local government's finance settlement, it was confirmed that that flexibility is extended to 2030. So that does mean that there may be an opportunity to revise our flexible use of capital receipts policy that comes forwards for approval, and to look at how possibly some of the resources to support our future council could be funded by flexible use of capital receipts, on the basis that the definition for using flexible use of capital receipts is aligned to the purpose of our future council around transforming service delivery. So there may be an opportunity that comes forwards to align those more closely. But at the timing of these papers, that flexibility hadn't been confirmed for future years, so we weren't able to do that.
Okay, I think Councillor Gray wanted to come back.
Yes, thank you, Chair. Yes, all makes perfect sense to me. I think capital receipts to fund redesign is a good thing, and I would encourage the council to extend that further for the whole of the length of the next council. But back to the central issue. I think, excuse me, I think Ada and I are going to disagree on this probably forever. But it does say these are principles. That's what it says in the document. These are principles. They guide us in what we do. And the first principle is we will not balance the budget strategy. Now, one council savings are part of the strategy. Therefore, we are using. Now, I don't really have a problem. I think I'm with Councillor Heatley on this. If we're going to do this and we're not quite sure whether it's 15 or 12 or whatever we save, I really don't have a problem. We need to service redesign to get the cost down. What I would really object to strongly is claiming that we're not doing it when we are doing it. So my recommendation is just remove Principle 1 or amend it saying that temporarily we're using or underwriting or whatever word you want to use, but it's misleading to residents, it's misleading to councillors to say we're not doing it with the right hand when we are doing it with the left hand. Thank you.
Can I just say, I mean, yes, okay, thank you, Councillor Flower. I'll bring you in a moment. With regards to this, I think this is something I would like to put forward to the Cabinet to consider because, I mean, I've certainly got it as a question. There's certainly probably more councillors around here got it. I think Councillor Ireland had it. I think it's certainly something that the Cabinet needs to reconsider, which is their principles that they work into, because it certainly feels to me as if it's disingenuous. We you know, sort of over the years, we have used a lot of our reserves, and we're actually using the reserves to plug a hole intentionally this year. If I can go over to Councillor Flower, and then I will come back to Councillor Orell and Councillor Ezard.
Thank you very much, Chairman. If I follow on from what Aidan and Sean have said, if there's some uncertainty about the principles, maybe we need to clarify the principles about not crudely using reserves to balance budgets without having a comprehensive programme of transformation. And if you look back at the history of this council, we embraced transformation even back in the days of the shadow council. And each year we've done that. And we've got a proud record of achieving transformation, reducing costs significantly and not having to reduce services. And if I look around the country, I see huge numbers of councils balancing budgets by cutting services. That's a crude, old-fashioned way of not embracing the possibilities of doing things differently. We've embraced that, and we've embraced it very well. And the phase that we're looking at now is very much about process, in my judgment, because every organisation has got process in it. Have we embraced all modern technology, modern ways of doing things, so we can, slicken up the way our processes operate, so the money can go into the delivery of our services? That's the aspiration I've got. And I think that the clarity around the definition of use, the principles of the use of reserves, I think has been well made. I do understand what David Gray's saying, and Brian Heatley, but the clarity needs to be around what the principles are. It isn't the crude use of reserves. It's challenging ourselves, knowing that if we don't meet all or some of the assumptions, all budgets are based on a level of assumption. They're based on as much good information as you've got with a degree of assumption. And I came out of a commercial world in business. We had to make a profit and you had to sell your products. And just scrapping products so you can balance your budget isn't going to do you very much good, because the next year you're going to lose trade and therefore you're going to be in trouble. I don't think we're in that position. I think we've got a proud record and we need to build on it. And I'm confident that this will be a good budget underpinned by our reserves. And I saw a comment made by a government minister only recently that said reserves are there for a rainy day. Well, we've managed to push ourselves away from the rainy day. I can say there's lots of council leaders around the country that would take my arm off to be in the position we're in as a council. We're in a strong position. We only will sustain that strength by challenging ourselves to be as efficient as we possibly can, so we can sustain our services. Thank you, Chairman.
Thank you very much for that. I think I would just come back on a couple of those. We're in such a strong position because we have such a high council tax in this area. I believe we're about 4th highest in the country, and that's probably the main reason that we're still afloat and still doing really well. But it's not really, talking on doorsteps, it's not really what our residents want. Certainly, I know this is one of the problems that Somerset have got. They would take their arm off to have a council tax revenue at the size that ours is. So, and I think I'm still not personally content with this use of reserves because we have absolutely no detail on it. And just going forward, I'm very concerned that this, under the definition of what a balanced budget is, because I don't know where these 12 million are actually going to come from, apart from just 5 principles that we've got, I remain concerned. Can I go to, no, just at the moment. Can I go to Councillor Orrell, please?
Thank you, Madam Chair. Councillor Orrell, Malcolm Regis, which is Weymouth Town Centre. I'm going to go in a slightly different direction. We're a people and health committee. My concern is people and health. Understandably, we're talking about money today, but I'd like to put money where it should be, serving people and health. We hear repeatedly, transformation, reallocations. They're cuts. My fear is that these words that we use underlie a cut in service, and people suffer from those changes. I've seen it anecdotally. I remember about 5 years ago, a similar meeting to this, a portfolio holder showing some financial tables, which was great financial. The money looked great, but what I knew from looking at real people's lives is that people with sensory disabilities were totally affected by this sheet of positive finance. So there are human casualties for budget sheets. I've also seen in professional life the thresholds for intervention for people getting help in their homes just gradually creep up. I'm terribly sorry you don't meet the threshold for care. All the visits get shorter. Those are anecdotes. That's kind of weak evidence. This week, there's been some really solid evidence across the nation of what's been happening through this decade of cut after cut after cut. I think this is what we're engaged in again today. What we've seen is that the average height of our children is getting smaller compared with our European neighbours. Our children are being starved. What we've also seen is the life expectancy for men and women falling. For 100 years, people have been living longer, and now they're not. People are starting to die early, and the people that die early are the poor. We read in this report that we have a duty under public health to address health inequalities. So while I accept that probably what I'm saying today is going to make no difference, we should be aware that there are real implications of this relentless cutting. We may dress it up in fancy terms and pretend we're not cutting, but the reality is our children are smaller, our old people are dying. And this is the measurable result of a decade of this kind of policy. So coming to a question, I look at page 50 and I see that on the graph there, we are not doing well in terms of revenue support grant. I also note that some of the other authorities which we are enjoined to join in a kind of next level of transformation and councils joined are also not well funded. So it occurs to me that we are year after year told that people are asking for Dorset to be properly funded. It occurs to me from that graph that this isn't working. And could this committee call on our cabinet to ensure that we are funded properly so that we don't have to cut services to our children and our old people?
I'm more than happy to put that through as a recommendation to Cabinet. It's interesting, I come from Leicester originally, and the temptation to move back with the rates that they have there is quite astounding, but it's awful when you look at how little Dorset gets. And the Cabinet really need to grasp that and take that through the government. Because the bottom line is, I know they've been trying. but it hasn't worked. We still haven't got the additional money that we need here. So I'm quite happy to put that back through Cabinet for another request. Just coming back on what you talked about earlier, I was just doing some work around inflation, and I am coming to a question in a moment, that food prices have gone up by, this is often the .gov website, food prices are up by 27% in 2 years. Half of adults are buying less food, and a third of adults are struggling with rents and mortgages. And that actually puts it into perspective. So just coming to my question, actually, which is around the table on page 46, where what we were originally looking at was inflation at 2.5% and an increase in fees and charges at 2.5%. What we're now looking at as a revised is 3.2% inflation and a 5% increase in fees and charges. And I know we've spoken a lot this morning about fees and charges and basically obtaining more income from them. And I know fees and charges, we can either sell more or we can put our prices up, so it's where the balance is there. But I'd just like some assurances that inflation estimates are going to be roughly right, because we are coming down, but if we're looking at an average inflation for the whole year, we need to have an average inflation factored in there. And at the moment, I think it's standing at about 3.7, 3.9%. So how confident are we that the 3.2% is achievable? And I'd just like some comment as to why, if inflation is at 3.2, why are we looking at 5% for fees and charges? And I'd just like a bit more of an explanation on that.
Okay, thank you. So the table on page 46 detailing that. So let me just orientate members on that table. So this time last year, our assumptions for next year was that inflation would have fallen in line with the Bank of England modelling assumptions down to 2.5%. So when we were preparing our medium-term financial plan this time last year, we assumed that inflation would be at 2.5%. So that hasn't been achieved from a national economic perspective. So we have therefore revised our assumption that the inflation that we will fund as a council is at 3.2%. Now, for next financial year, on average at the midpoint. Now, I haven't, my crystal ball is no better than the Bank of England or indeed the government's or anybody else's. So it's a difficult one. But your point in particular about different products, different categories of inflation is a really important one. So that's an average level of inflation. We've put in additional money for some of the areas where we know where the prices have been going up faster. So, for example, utilities. I referenced utilities earlier. So we've set aside an additional amount for utilities. But on average, we're anticipating inflation is at 3.2%. Conversely, reading the papers this morning, there's talk that inflation will come down. You know, it could be 2% when the latest inflation figures are announced next week. Who's to say? But this is first of all, our best estimate of what we think we as a council can live with next year. Our policy, we've written to our suppliers and saying that we're expecting them to absorb their cost pressures next year. And this is us setting aside some money for those contracts that don't allow for it. But this does then open up this whole issue of risk management, financial risk management. So if our suppliers' inflation is over 3.2%, if the nationally negotiated pay award is more than 5%, then we have set aside a contingency within the budget of about £5 million to offset some of that risk. Your other point about fees and charges, looking to increase fees and charges around 5%, comes back to the income discussion that we had earlier. This isn't necessarily achieved just by increasing prices by 5%. It could be by freezing prices, but better marketing, increasing volume by 5%. But that's a figure that we, on average, believe is sustainable across the organisation. We're looking for individual budget managers and services to work out what's best within the legislation, what's best for them and their services, what's most appropriate, what can the market sustain. Thank you.
Okay, thank you. Councillor Azard.
Thank you. Yes, I would like to go back to my question on the new homes bonus that I'd like Aidan to answer, but also it is, concerning to me actually to say to invest to save is disingenuous, because it's like saying, let's speculate to accumulate. And I think the invest to save is pure speculation without too much, depth to it. And I think that this 12 million that you're trying to save out of next year's budget is not going to come to fruition because of all the extra costs that we've got everywhere. That if you go and ask anyone, especially like in, some of the place areas, and I know we're not discussing that today, from our point of view, from our wards, they say, all the budget's gone, and anything you ask for is that, oh, well, it's no good even asking for that. It's never going to come online for the next 5-10 years. And so actually, thinking about anything that you're going to put in that's going to actually improve things is going to be very difficult to do because it's all swallowed up with all the, costs that are going up. But the other thing I would like to think that if we've got our, any money at all, then it ought to go into actually extra adult social care and children's, but also into housing, because, we're desperate for housing. We've got lots of homeless people, and I think that it's so important to look after the vulnerable and the homeless. The other thing I'd like to say is, we have got a climate emergency and things are getting worse and worse, and if there is any money to be spent anywhere, we should be pouring it into actually lots more climate emergency policies, and also doing a lot more for digital stuff that's coming online as well. And I think that it's very important that we have all of those things, and I know it's probably not to be discussed here, but I think it is disingenuous to think that we can make savings in the next year when, let's face it, the government will not give us, will only give us a short-term, year-on-year settlement. So how are we going to plan for the next 5 years when we've got no idea what the government's going to do in the next year or so? So I'm sorry, I can't support this at all overall. Thank you.
Thank you. I don't know whether Aidan can pick up on the new homes bonus information, and certainly Councillor Sompers wanting to come back in. I was going to ask questions about the adult social care grant and the sustainability of that. So if I can go to Aidan first and then come back over to adult services, please.
Thanks. Aidan's asked me to answer this one. So new homes bonus, as was mentioned, is based on the number of units delivered. There's a reasonably complicated formula around assessing a baseline growth level and essentially having to exceed that to get the grant funding. So perhaps we could circulate a briefing as to more details of how it's allocated after the meeting. But just in simple terms, the number of units delivered in Dorset resulted in the allocation of just over 900,000, which is essentially half the allocation we got last year. The good news, though, within that figure is, as was mentioned about housing need, is that the number of affordable units within the houses delivered receives an additional direct kind of incentive at £350 per unit. So for Dorset this year, we got more money through that affordable unit, as whilst numbers were down, the affordable units delivered were higher. So we received just over £100,000 for the delivery of affordable units. So and whilst the funding was down, it's perhaps there is a positive in there that the number of affordable units was going up compared to the allocation we got last year, and therefore the numbers that we delivered. But perhaps I can circulate it a bit more detail as to the calculations after the meeting.
Thank you. And if I can go over to adults, please.
Thank you, Chairman. Just before I hand over to John, who will speak on the grant specific. Invest to Save is a rigid, detailed process. It is not a speculation. We have to go through extremely robust processes to get through to Aidan and his team providing a strong business case. Beryl, you will be very aware of the business cases for reablement that are going through. They are not made up. They are real, well evidenced through data, working also with our health colleagues. So I really feel strongly to make that point. Children's are not here to talk about the Invest to Save work that they've done, which has been extensive. So I can't speak for another directorate, but I think we're all very aware of the work they've done, and they also have to go through a very rigid and robust process to receive the funding that's required for specific projects. So I'm just going to hand over now to John, who will talk specifically around the grant.
Okay, so the market sustainability grant has been sort of passported over the last year, and there's an additional payment of 1.4 million next year on top of what's already been put into our budgets for this year. So was there a specific question on any of that?
I think I'm just looking at 13.26, where we're talking about the social care grant and the certainty about the future of that. And I was just wondering whether there's any, there's obviously no clarity about it at the moment, but are we making any provision for changes, particularly reductions in that?
So it's really difficult to guess what the future will bring. I mean, certainly we've got certainty about that funding for next year, which is really good. Personally, I would expect that to continue because from a whole systems perspective, the benefits have been seen, and you know, it would potentially be a false economy to have that withdrawn, but I can't really comment on what the future policy will be in that space.
Okay, thank you. Could I just ask Aidan if that's in as one of the risks? It is, okay. Where have we got to? Have we got any more questions? Right. Councillor Gray.
Some guidance, please, Chair. I've got a question which doesn't easily fit within the People and Health or indeed into place, but as the Executive Director for Finance is here, I wondered whether you would allow it.
He's saying no. But just to put him out of his misery, I think we'll take that next before going on to housing.
Thank you for your indulgence. This passed me by when it went through the budget cafes, but if I can ask Aidan, on page 59, I'm talking about the medium-term financial plan here, and astounded to see that we'll get 50 million from business rates for 23-24. We've budgeted for 63.9 million for 24-25, and then it goes back down to 60. Now, the medium-term financial plan is balanced by the additional 13 million that we'll get from business rates. And there is some text in the report, but it worries me that we're budgeting for 13 million pounds worth of additional business rates. And could he explain that? And if there's been an increase, I've missed it, but it does seem a staggering amount. Thank you.
Good question, really good question. Thank you. And business rates has been an area of, I think, volatility is the wrong word, but we generated more income, much more income this year than we'd anticipated. And when we've explored this, our budget assumptions in previous years have been based on government-provided information, essentially. And we've talked about, and some of that information is provided in the data here in the report. So we've used government-based assumptions about our business rate incomes. We, like many other local authorities, started to see more income coming in than the government suggested that we might, and thought there were sort of local circumstances, and in particular, as we sort of recover from COVID. So we've sought external advice from a company called LG Futures, we and many other local authorities have, who have supported us do a deep dive and deep analysis that essentially has given us the absolute confidence that we're able to set a higher budget than the government has predicted due to the local circumstances. So that has given us a significant increase of business rate income this year, but also gives us confidence to sort of move it from this current year's budget of 50 million to actually into 63 next year. And that's been a really beneficial improvement in helping manage our financial position for next financial year. So I hope that helps. So I appreciate it's a complex area, so it might be for a conversation outside of this meeting if you want further detail.
I think Councillor Gray is happy, but I think he may come back to that one later. Okay, right, we need to move on. We've got really two other areas that we need to explore. One is housing finance, and then I'll call the last one as transport for children and adults. So, sorry.
Is it possible to have a quick break at your convenience, please?
Again. So, right, we have two parts to on our agenda before the end of this meeting. What I'd like to do, we're coming up to the 3 hours, so I'd like to have a vote to extend the meeting. I'm going to say to extend it no later than 1:30. I think that should give us time to do the last two parts, and we may want a bit of a chat about what we've got going forward or how we're going to proceed with this. So if I can propose that we extend the meeting to 1:30, can I have a seconder? Yeah, I've got a seconder, and can I show a quick show of hands? Oh, that's brilliant. Okay, thank you very much. Right, if we can move on to housing now. We started on housing with a new homes bonus information. I don't know, we've got Andrew Billany is online, I believe, this morning, and is unable to be here for health reasons, but he is online, so hopefully he can either take some questions. Good afternoon, Andrew. Hoping you're feeling not too bad. Right. Do we want to go straight into questions, I think, on the housing part? I think, yeah, okay. So, right, I've got a question first of all. If anyone wants to ask questions, please come in. My questions are around the plans to reduce the use of bed and breakfast. I wonder if you can explain how we're going to do this. And we've been doing this now for quite a while. How effective has it been? Are the plans and the mitigations that we've put in place made a real difference?
Do you want me to answer that question, Chair, or
yeah, yes, please, if you could, please.
Yes, certainly. Okay. I mean, I think we've had sort of sessions around scrutiny and overview on performance so far, and start on a positive. Is our performance in managing the number of people in bed and breakfast and temporary accommodation stands strongly against other benchmark local authorities. So at the moment, our number of households in bed and breakfast is around 90, 11 families, which is too many, but it's a number that's stayed. We've managed to get it under 100 from the peak of around 150 in total, single people and families a couple of years ago, and that's better than the majority of local authorities around the country. So I'll start with that in terms of sort of tribute to the team in preventing people moving into bed and breakfast and temporary accommodation, but also moving people on into more settled accommodation. So to answer your question about what we do about it, I think it's to some extent it's doing, and our pathway so far is to focus particularly strongly on prevention. And Sam Brand, the heads of our homelessness prevention team, we've set up new initiatives around we call the tenancy sustainment team, for example, relatively new proposal, but it's to make sure we're in there at the beginning to make sure we're working with landlords, and that could be private landlord, could be a social landlord, to make sure evictions are prevented or that alternatives are found for people who would normally come to us as homeless. So that focus on prevention has been one of the reasons why our performance is relatively good. Where we're looking to emphasise more work is that move on position where people are in temporary accommodation and moving them on into settled, and that could be the pipeline of social housing being built by the registered providers, but also it could be around making sure we get alternative private rented provision. And whilst the local housing allowance changes, increasing the cap to the bottom 30% of the market, whilst that's not given us any benefits in what we recover for temporary accommodation, it does give us more options within that prevention arena, so that if people have lost a private rented property and they just want another one, that raising of the housing benefit cap will help us as we go forward. And there was an announcement only 2 or 3 days ago to announce that cap being raised. I could go on, Jill, but I think it's around an ongoing piece of work, as you'll see in the paper, demand has increased by 28% over the course of the year. So keeping those numbers coming down is a particularly strong performance. And the solutions are manifold. So it is about getting settled accommodation, but also, where possible, is to help people find their own solutions as well. So I could be, by all means, probe further, but in general terms, that's my answer.
Okay, thank you very much for that, Andrew. I'm just wondering around, you're talking about settled accommodation. In the past, the council has purchased houses as part of a number of schemes. One was, I believe, the Afghan scheme last year. And I'm just wondering whether there are any plans at the moment to continue that purchasing. So we've got basically temporary accommodation, which isn't B&B.
Yes, we've relatively small numbers, but over the course of the last 3 years, since in the time I've been in post, we've acquired, I think, 66. I need to just check the numbers. It's 60. I think the figure is 66 homes through government grants, and that's you mentioned the funding we had to get some accommodation for large family homes for Ukrainian and Afghan households, but also the bulk of those numbers are for single homeless, for rough sleeper initiatives. The rough sleeper accommodation program, for example, we've successfully acquired properties for people who've been sleeping rough in particular, and then getting them into homes with enhanced support to make sure that they can maintain their tenancies and be settled. It hasn't just been about getting them a home, it's getting them the appropriate support to sustain those tenancies. So yes, we did. That is part of, that's what I'm trying to say about not a single solution. That is one of the things that we've done, and it's about working with our government advisors as well. So we've been successful in getting government grant to support our own investment as a council into that work. So yeah, just checked, it's 66 homes over the last 3 years.
Okay, that's brilliant, and it's really good to hear. I'm just wondering, going forward on this, whether there obviously isn't a fund within the council for this. So when we have grants that become available, as last year, we then have to take things through Cabinet for additional money for that sort of thing. I'm just wondering whether that is the plan for this year, should more grants become available? Because just looking at private rented, in particular, the number of private rented is decreasing. I've had 2 people this week phone me on private rented, just having had their Section 21 notices. So it's obvious the numbers of private rented are going down, but also the cost of private rented is going up. And that's going to be a real challenge. And I know we're doing an awful lot of work with homelessness prevention, and I think that is absolutely brilliant. And I take my hat off to the officers who are doing that work and to yourself. But I'm just wondering, going forward, where we're going with this, because this is just going to get worse out there.
I think in can I just answer in general terms, because Councillor Somper could join in as well, because you'll have known we've done a lot of work around the housing strategy over the course of last year, and as we're developing the delivery plan from that strategy, is the work across members as well as residents and stakeholders, is getting that right. So make sure we're staying nimble and alert to whatever challenges are there. At the moment, it's tough, but it's about us getting a delivery plan that gets ahead of those challenges. And what you're saying is private rents are going up, and supply is challenging in certain areas. It's how we're tackling that, and it could be to intervene, but it's more often working with our landlords and property owners to make sure we get as much from that as we can. But at delivery, it's a flag towards that delivery plan that will be a feature of certainly the first quarter of this year, or the next quarter rather, is getting that delivery plan right.
Okay, thank you. Sorry, who? Councillor Somper, please.
Thank you very much, Chairman. Thank you, Andrew, as well, for providing all that level of detail. Yes, you'll all know, obviously, we had the housing strategy, which went through its various phases. And now the focus is going to be on the delivery plan and looking at housing need, housing supply, housing standards, prevention of homelessness. And I reiterated when I spoke at full council about that prevention element, which I want to see strengthened. I know they do incredible work in that space, so supporting that is really vital. Obviously, I'm hopeful, and I know that obviously the development of that delivery plan, I will be looking for lots of input from members through overview or task and finish, however it may work, to be able to help formulate that as we move forward.
Thank you. Have I got any more questions on housing? Councillor Ireland? Sorry.
Yeah, this is. I just want to go back to the new homes bonus. I think Councillor Arezzo managed to jump in early, but I think the answer was it's complicated. So there's a table on page 46, and we're at the lowest amount we're receiving for 6 years. It's been as high as 3.8, but now down to 0.89. I guess the two questions, simple questions, I hope. Does the fact that it's reduced imply some sort of failure of Dorset Council to do something? And what's the impact of it halving?
I perhaps won't comment on whether it's a failing or not. So the new homes bonus is allocated based on the number of units delivered. I suppose the council has a role to play, or the planning authority part of the council has a role to play in encouraging developments to come forwards and approving those. But I don't know that, I obviously couldn't comment on it failing, but I think it's a sense that the number of houses delivered is lower than it was last time on the basis that the funding has been reduced. I suppose the views as to whether that's a success or not is perhaps for someone else to decide. But I think there is a possible question for scrutiny next time, which is placing resources around what's the role of the planning authority perhaps in encouraging and bringing forward those developments. And that's not, the new homes bonus isn't related to how many housing units are brought forward by the council itself, in the examples that Andrew was describing. So I think the council is involved in bringing housing forward, but perhaps not solely responsible for those numbers. But again, perhaps a question for scrutiny next week when you've got the representatives from the planning function able to talk a bit more.
Okay, so I think there are no other questions on housing, so thank you very much, Andrew. Oh, you've got your hand up again.
No, I just wanted to just reinforce Sean's point. I'm sure most people on this call will appreciate the new homes bonus is based on all housing, whereas I think Sean made the point earlier, the affordable housing is actually increased. So just wanted to make that distinction crystal clear. So thank you.
Thank you very much. Right. So I think we'll close the bit on housing, and I don't think we've really got any recommendations to go forward on that one. And we're just on to the last part now, which is transport for children and adults. And I wonder if, Aidan, you can give us a bit more of an explanation of this, because I know it comes under place services, but it's driven by need from within children and adults, which is why I think we do need to discuss it here. So if I can just hand over to you and how this works and why it's under place, and then we can open up the debate on it. Thank you.
Okay, thank you. And this is a really significant issue for the committee to explore, because it's one of our highest financial risks as an authority, in particular the cost of home to school transport for children with special educational needs. It's a rising cost. So in particular, if we look at section 19.34 in the report, we see that within the Place Directorate, there's a service pressure for special educational needs transport of £12 million. So that is, first of all, making good an overspend for this financial year and then building in some headroom into next financial year. So that's a really significant uplift. So the first point I'd like to touch on is who is responsible for home to school transport. And I think what we've recognised as an authority is that it's everybody. It's an organisational wide issue. We've each got a role to play. So in the early days of the local authority, the home to school transport budget was sat with children's services, which might seem the most logical place for it to be. But a couple of, I think it's 3 years ago, we transferred the budget into the Place Directorate because they're much closer to other transport budgets and the general public transport as well. So that makes a logic there. So I'm conscious that we'll be exploring the place aspects at the committee next week. So I think the conversation today would be really helpful to centre in particular on it's because they're in the room. Adults, how do they make use of transport? What does that impact for Dorset Council? And then I can touch on children's services first, if I may, because they're not with us. I think in terms of the life cycle of the use of transport, we have statutory responsibilities, in particular to get children with special educational needs to school. We have a responsibility, and we need to meet that statutory responsibility, but in the most efficient and cost-effective way possible. One of the things that we've seen, I mentioned earlier, the rising number of children with special educational needs. So that, first of all, means that there's more children to be transported. And secondly, they're increasing, at the moment, we've got a few larger facilities around the county, so we have to transport the children quite a long way. Our strategy, and I mentioned the bid for funding to the DFE, is to have more facilities around Dorset so we can so they're in the local community, but also it benefits our transport costs. So to try and manage this budget, there's a piece there about predicting the number of children needing support. There's making sure that we have the correct policy and that policy is applied appropriately as well. But very clearly, we listen to what parents have to say as advocates of their children, and there's always sort of quite difficult conversations about what's the most appropriate location and how to transport the child there. We've got different approaches within children's services to try and manage the budget to some extent. Where possible, we provide training for children so that they can use public transport as opposed to expensive taxis. So that's part of the approach we're trying to look at, that we're using. We, on occasion, and indeed are keen to encourage personal budgets so that we fund the family. We give the family funding to transport the child, and they can make their own arrangements within that money. But one of the issues that we really that we are experiencing cost pressures on is, frankly, the cost of transporting the children in vehicles that we have arranged for. And that's where the Place Directorate gets involved, making the travel arrangements. So children's services policy and the application of the policy, Place Services is optimising the routes and trying to make the most cost-effective way of transporting the children whilst meeting the needs of that child who in many occasions have sort of quite challenging behaviours, which determines the sort of vehicle and the number of children, colleagues they can travel with. So I think my key point is this isn't just a single directorate's problem or a challenge in terms of the budget. It's the solution lies in us as an organisation working across the spectrum. Thank you.
Thank you very much. Can I just ask a question on that? You're talking about, and this is children, so it may have to be one that we take away. You're talking about units being set up across the county for children to reduce the transport needs, among other things, and produce something in the area that the children need, which is great, because it's very children-orientated, children-focused, and that's the way it's got to be. But we're still going to have the issue that a parent may challenge a placement and want the child to go somewhere else for all good reasons, and we don't tend to challenge those, or don't challenge robustly, because we very rarely win those appeals. So have we got any evidence that if we facilitate centres around Dorset, that this is actually going to reduce transport, or are we just going to increase it because there will be different schools that produce that have different skills, different strengths, and we're basically increasing the amount of choice, therefore increasing the amount of choice to anybody who would like to appeal against the school they've been allocated. Do you see what I mean? Are we actually producing the converse of what we're trying to produce?
Okay, thank you. So from a policy perspective, and sort of from a children-centred policy perspective, we believe that the children having the opportunity to learn within their local communities, be supported in their local communities, is really important. And so therefore, building specialist facilities on existing school sites, we think is really, really important. And that's in the best interest of the children. And in particular, there's a byproduct there that's best interest of the travel budget. And so we kind of take that into account when making the decisions. But ultimately, as you describe, there comes a point if the parents don't agree, that occasionally we sort of get a legal challenge, and we have to abide by the judgment of the judge, and that on occasion can lead to expensive transport costs. And I think this is one of the things that, as a council, we try and control the things we can control. Some things are outside our control, and the costs therefore go up and up. And so coming back to the earliest point, we have to make a judgment about how much do we think costs will be going up next year through combination of demand and price. We think it will be potentially £5 million more than this year.
Okay, thank you. I've got Councillor Rennie coming in wanting to ask a question. Can I go to you, Molly?
Thank you. Thank you very much. Nice to see everybody and Happy New Year. I wanted to ask a question. It's interesting that you talked about, Aidan, you mentioned the fact that sometimes within a council things don't quite fit in where it should be and not one single directorate. And I wanted to ask a question around school transport. And this question, for me, fits not just within the normal place and children's, but in housing and planning as well. And the budget for our school transport continually rises, not just in the SEN area, but in school transport in general. I sit on the appeals panel for school transport, and the number of people coming forward seems to be increasing, looking for school transport, and increasingly coming from areas where we are building homes under maybe a 106 agreement, and these are affordable homes, and we're able to house people who are on our register or maybe coming from our B&B and emergency accommodation. But these homes are very, very welcome, but sometimes they are just slightly outside the area for the 3-mile cut-off for school transport. The latest one I heard about was just outside Dorchester, where the large number of homes are being built, and on the outside edge of this development are going to be more and more of these affordable homes. There is an infant school in that village, but for middle school and senior school, all the children will have to come in to Dorchester, which takes them outside the distance allowable to have free school transport. And I think I'm not expecting an answer to this at this moment, but with our transport budget going up and up and up, I would hate to see us, and I think it's a national policy around the distance travelled, but the more and more appeals we have makes it more and more difficult for people to go to work, for the children to attend school, or maybe even take a house that is offered to them if they've got to have more than one child coming into school and they've got to pay for private transport for them to come into school. And I'm not quite sure where this fits. As you say, it is multiple directorates, not one single one. But I don't want us to lose sight of this as we move forward and find ourselves having to dismiss appeals just because we have no money left as we get towards the end of the next financial year. Thank you.
Thank you. I'm afraid my response won't be as sophisticated as the question, but what the question really highlights is that this absolutely demonstrates that transport isn't a single directorate issue. It encompasses, just in that conversation there, matters of economic development, economic growth, jobs, employment, about planning, about housing, and then about transportation, and then about school building and space-based planning for schools. So this just reinforces the point that it doesn't matter where the transport budget sits, it's got to be a whole council approach. I've had my colleague Matthew Piles, who's corporate director for planning and heads up the transport team as well, was listening in. I think these are a few points that Matthew may well be able to address next week at the Place and Resources Committee. But I think it just really does, as I say, highlights that this is a multi-organisational, multi-dimensional issue. Thank you.
Thank you very much indeed. And thank you for taking the question, Jill.
Sorry, what was that, Molly?
Thanks for taking the question.
I just said, basically, thank you.
Okay, thank you. Can I go to Councillor Gray now, please?
Thank you, Chair. I think I'm going to disagree again with Aidan. I think it does matter where the budget is, and I'll explain why. I think he's right in saying it cuts across most directorates, but financial principles dictate that when that happens, generally the user is the person that holds the budget, or the majority user. What you've got at the moment, of course, is that we've got multiple users, but Place Directorate have got the expertise. So children's and adults are using the service, but Place are responsible for the budget, which is probably the most, so sort of juxtaposition point where it's the least preferable situation to have it in place. My view is it should sit with the user, even if the user is just the majority user, and what you do is you buy in that experience and process into that directorate rather than separate it, and because it'll always overspend otherwise. I know it's demand led, but there are techniques and efficiencies that could be used. So my view is that it should sit with, dare I say, Children's and Adults Directorate, but there you go.
That's interesting. I would tend to agree with you there, because when you look at your own budgets, you wouldn't decide how many loaves of bread that you want and then expect somebody else to just bring them around and drop them off for you without having to pay for them, which is the same sort of analogy, because in my analogy, the other person who's doing it for you has got the budget and you just ask how many you want. So whether you ask for 5, whether you ask for 20 is immaterial to you. And I think that is a very good point. I don't know whether Aidan wants to bring that up or whether we want to have an argument here on this. I'm handing over to Aidan.
I think that would be a nice, crunchy, specific recommendation from the committee that we could reflect on and respond in the Cabinet papers. Please.
Beautifully slopey-shouldered. Thank you. Have I got any more questions on transport? Because we've also got adults teams here. Yes, Councillor Beer.
We just dealt with children, so we were going on to adult transport, weren't we? No, you can ask questions on either. Okay, thank you. Thank you, Chairman. Because of our predominantly rural area, there's a massive dependence now on volunteer car schemes to get our people who are vulnerable or isolated to appointments and just into town and such like. And I know from personal experience or dealing with volunteer car schemes that they're at breaking point at the moment. I know of one which on a Saturday has taken 40 different people a 16-mile round trip just to get their jabs and such like, because they don't have public transport and they're not allowed to drive. The problem is that these volunteer car schemes, as I say, are a breaking point, and they don't think they're properly recognised, or perhaps they should be funded a little bit to enable them to continue. The demand is massive. The need for the individuals is great, and I think we really do have to build in the volunteer car schemes in our isolated rural areas, or even in our towns. Sometimes people have to go 30 miles to a hospital, and it takes a great deal of volunteer effort to fill that need. They're not funded, and they almost feel they're taken for granted. Do we have a plan in place to think of them as the fourth arm of public transport, if you like? Thank you, Chairman.
I'm happy to take that question because it really does impact on people's health. You mentioned 40 people getting picked up for vaccinations, and then we're starting to look at public health and adult health issues. So just from within that, I just wonder whether adults would like to respond as how you're working with volunteers, basically, to get people in for your services, and whether you're, how this is actually run, whether it's just run through our own buses, or whether there's any scope to extend the voluntary sector and give them more support.
Thank you very much, Chairman. I can only give a kind of scant response because I know that the VCS, the Voluntary and Community Sector Strategy, is coming forward very soon. So that will possibly be the area there to be looking at that. Obviously, we work closely with the voluntary and community sector. Buses are used for, or minibuses are used for day services. Within adults, and you'll know our budget's about 1.4 million on transport. I can't really expand more on that. I think there would be a piece of work on that, on the VCS, on what's in there. I mean, locally, Councillor Beer was talking about the those volunteers, and I know lots of people use them, and I know lots of people who are the volunteers. There's also a Nordcat, the minibus service, which is very well used in our area. I can't comment for anywhere else. It's a bit specific. So I think looking at that VCS strategy when that comes through, which is imminently, I think. Sorry. Yes, also there's another, sorry, John's also pointed out, of course, there's another area and element in this around our health partners as well. You know, obviously for medical appointments, hospital appointments, GP appointments, that sort of thing, and what, you know, what they're doing as well, or not.
Sorry, is that okay, Councillor Beer? Are you happy with that answer?
It's encouraging to know that guidance is coming forward. Let's hope the guidance is sensible and works with the issues of rural communities rather than based upon urban areas where life is very different. It is urgent. It is really urgent. I know of people who, organisers of community car schemes, who said, we just can't cope anymore. We can't do it. We're going to have to throw in the towel. So this authority is in a position to remedy that and help our people. It's people. It's not just people with mental health. It's people who really can't drive or who are suffering from social isolation. It is massive, and let's hope that the guidance comes through soon, and let's hope that we're able to influence it. Thank you, Chairman.
Okay, thank you very much. Sorry, Councillor Somper wanted to come back.
Yeah, sorry, I can't speak for that report. It's not it's not my report, but I do know it's coming soon, and I think it's an ideal opportunity to explore that on a wider scale, obviously, and also through the what Help and Kindness has to offer on those platforms as well, and the work that they do with the voluntary and community sector, and how that piece of work is ongoing as well. I also very close to Councillor Beer in my ward, which is very rural, so I'm personally very aware of the issues there, but also aware of the good work that goes on with various groups. But you're right, you know, sometimes they are very pressed.
Okay, thank you very much. Any more questions on transport? Right, so I think we've come to the end of the budget. Unless anybody else has got any more questions, I think we're there. Sorry? Yeah, can I just check that we had a discussion, and I see Councillor Gray has gone, about which directorate holds budgets for transport, and that we were thinking of taking that forward to Cabinet as a question. I think we're generally in agreement with that. So, okay, thank you very much. Right, I'm going to call the end to the budget discussion. I think we've spent, gosh, about over 3.5 hours on it. I think we've taken it apart pretty well. What we will be doing is I've asked George if he can put together the minutes and the recommendations for Cabinet, and I'll forward them to the members who were here today just for comment. And they're also going to go to officers for comment before they're included in the Cabinet papers. Right, we're now on to item 9, which is exempt business. There is no exempt business, so I'm going to call an end to the meeting, and I don't know what the time is. 13:31, so we've gone 1 minute over. And thank you everybody for coming today and taking part in the really good, useful debates that we've had.